21 to 25 is the range, but 21 is optimum. Okay, so you will get questions based on this, but let us try and start with the questions. Let me ask you regarding the capillary puncture. So if you want to go through the information just quickly, we can go through, because I may ask questions based on this. When we do the capillary collection, okay, here, you have the book. The book is with the phlebotomy essentials. That's what you have to refer. And now, look, capillary collection, we all know. So you will get a question based on the lancets. For example, the lancets can be used one time only, or they can be reused, or they have to store it and then you can recycle with the other patient. What could be your answer?
Sir.
Yeah.
It's
Zarina Main? Sorry. Yes.
Hi, good morning, ma'am.
Hi, good morning.
For the lancets, I think we use the sterile ones, and after we use it, we just dispose it on the sharps.
Yeah, very good. So this will be one type of question, okay, in this particular part. And then now look at this one, type of lancets. What is the maximum depth that you can use? Or the microtainers, the what do you call the stopper of the or what we call the top of the microtainers will have different colors. Yes, Yusra, what's your question?
My question is the question that you just asked about how depth, the maximum depth is that this 2 millimeter, is it for both adults and neonates?
For neonates, 0.5, 0.85, it will be there. For neonates, depending on the options you have to select. My question is the max.
The max is for both for neonates, or
Yes, the max for the neonates is 1 to 1.2, sometimes 1.5. Generally speaking, the max is 2 to 2.5, but usually 2 will be the closest number. Some books give, for example, when I studied, in one book I saw 2.4. In one book I saw 2 for the as the max. But generally speaking, when we talk to the ML Power, so if you have questions, you can email ML Power, or you can ask someone who is like senior, so they will explain. So but the proper is 2 is the max.
okay.
If you get 2.4 in the options, pick 2.4. That's the max. But 2 is the max according to the book that you have. 2 is the max.
Okay.
So will there be different colored stoppers when it comes to the microtainers? What is the answer? Zarina, mind you put your hand down. I have to give the opportunity to others. If you're going to answer, then
Ma'am, I have a question.
you have a question. Sorry.
Yes.
Yes. Uh-huh.
For the microtainers, we use the EDTA and serum and other additives. Do we use the light blue top here or no?
Which one?
The sodium citrate?
The blue usually we don't. I haven't seen blue. Right? Blue
Okay.
is mainly collected in the tube that we use regularly. I haven't seen blue in this. Okay, so don't
Okay.
worry about that. But generally, there is an order of draw. This is an important. This is very, very important. You may get a question, or you will get a question. The thing is, what is the order of draw for microtainers? We all know the order of draw for the regular tubes, the vacuum tubes, right? Now, the order of draw. Who mandates the order of draw? The CLSI. Yes, Yusra. Any question?
No, sorry.
Okay, so the CLSA says when it comes to the capillary puncture, the microtainers, the order of draw is different. First, the blood gases is usually green because it's a stat. Blood gases is green. It's a stat. Okay, and this one comes first. The blood gases comes first, EDTA next, other additives, and serum, the reverse order. Whereas when you see the regular ETS system, first comes the SST, which is the serum. I mean, other than the light blue, keep the light blue apart. Just stay away from the light blue here. just take the first one will be the serum. After the serum comes the green, then comes the EDTA. That's the order. But look at the order. This will be an important question. You may get it. Okay. Then the next one. Clear, all of you? First comes what? I want to know from everyone. First comes what? The green one, which is the blood gases. Then comes the
Lavender.
lavender.
EDTA.
Then comes the other additives. What could be the other additives?
The glucose or the
Yeah,
bread.
glucose, gray.
Gray
You mean the gray and everything? And then comes at the end will be the serum.
serum, the red top.
This is
Okay.
important. Now look at this. We all know what is someone, I think someone responded even yesterday, what is a capillary blood? We all know capillary blood has the blood from arterioles, venules, interstitial fluid. It's a combination. You will get a question in this. Then you will get a question. Who will be in more concentration when it comes to the, or which metabolite will be in more concentration when it comes to the venous blood? Or which will be increased in the capillary blood when compared to the venous blood? So you have to look for the options in the answer. Is it glucose that's been asked? Is it potassium that has been asked, or calcium, or a HCT? What has been asked? Usually they ask for glucose. Increase
Increase of
glucose,
glucose.
decrease glucose, increase potassium, decrease potassium. This will be the options. So you have to pick definitely increase glucose. Clear?
Clear.
Okay, now, when would we do this collection? This is another important question. There'll be the question they ask, the wordings are very important, as I told you before. You have to pay attention on the words. Sometimes they use the word NOT, not. So when it's a not, then you have to be alert. What is the not? No negative thing there. You know the positive thing. You might be knowing the answer, but the way they coin the words to ask question is critical. Okay, so small veins, severe burns, obese, thrombotic tendencies, POCT, veins needed for therapeutic treatment, melanophobia, iatrogenic anemia, all these options you have to know. Sometimes they will ask you which is not important when you look for the veins for capillary collection. So which is not very important, that will be sometimes in capitals, which means you have to look for the options. Sometimes they won't give the answer in that, but they will ask a question. If they say none of the above, which means if it is not applicable to any answer, you have to pick none of the above. So these things, the wordings are very important. You have to pay attention. Now, site. This you all know. You have to just collect in your brain. So is it index finger? No. Is it a middle finger? Yes. The other option is the ring finger? Yes. Which part of the finger? The laterals, not at the tip. So you have to know. You'll get a question. What are the sites to avoid? Earlobe, index finger, previous punctures, swollen or bruised ones, cold, infected. Why cold you have to avoid? Why if the fingers are too cold you have to avoid? Why?
Restricted blood flow.
Because the
Increase.
blood is not
Blood won't flow.
circulating
Even if you
properly.
poke so many times, nothing will come out. Waste of time. Right? And callus tissues, it will be very hard. So you won't, the poke won't be good, so you won't get the blood. Ergonomics, we talked about it. You have to sit, what's the position while collecting the capillary blood? When you do the ETS, even in the lab, do we sit?
No.
No, we just bend and collect it, but that should be the position. But here, you will sit. You'll be relaxed, you'll be sitting, and just your job is to hold the hand of the patient and collect the blood. You will be focusing fully on that. Now, this is an important question. What is the temperature? What should be the temperature? And for how many minutes you have to maintain the temperature to collect the blood? Before collecting the capillary puncture, before doing that, what should be the temperature of the hand? For how many minutes you have to do the massaging to get the blood? This is a question. Sometimes they will ask 37 degrees, 10 minutes. Sometimes they will ask 37 degrees, 5 minutes. And in the options, they will ask 42 degrees, 10 minutes. Okay? And 42 degrees, 5 minutes. So which option will you pick?
42 degrees, 5
Oh,
minutes.
42,
5
5
minutes.
minutes.
Now
Yep.
you're assembling the equipment, how you have to poke, everything should be there, sharps, bandage. This is a list. We all know about the list. And here the middle finger, how you grasp it, and then how you apply the warmth is given. And the cleaning procedure, they may ask a question, which is the best antiseptic when it comes to the cleaning for the capillary puncture? Is it betadine or iodine? In the option, if it is given, 99% alcohol, 95% alcohol, 70% alcohol, which should be your answer?
70%.
70%
isopropyl
alcohol. Why the reason is given? Sometimes if you use the povidone iodine as an antiseptic for the capillary puncture, what will happen? They will list out the options.
Increase K.
Increase potassium, increase phosphorus, increase uric acid. Okay, so this they may ask. And the puncture site where you have to poke. Grasp the patient hand with your non-dominant hand. You want to hold firmly. So sometimes you will hold the patient's hand with the dominant hand, non-dominant hand with the side, left, right. It doesn't matter. Non-dominant hand should be your answer. Okay. Now, we know we have to, now milking. There will be a question regarding the milking. What will happen during the capillary puncture when you're milking the finger? What do you mean by milking the finger? Pressing at the site of the puncture, just squeezing it to get the blood. What will happen? Someone answered this yesterday.
It will increase chance of hemolysis.
Hemolysis. And also there may be chance of contamination with the tissue fluid. Both can happen. And when you are collecting, now this one, when you're collecting using a capillary tube, what is the position of your hand?
If capillary tube, it's upward.
Yes,
Face
the
up.
palm
Face
should
up.
face up. And what is the position of the capillary tube?
Horizontal.
Horizontal position.
If it is a microtainer, what is the position of my hand?
Perpendicular
Down.
position.
Downward.
Palm
Palm
facing down.
facing down.
And this will be the microtainer. Clear? Because this is sucking by the force of gravity, or the blood drop is falling down with a gravitational pull. But in the capillary force in the tube is pulling the blood. Clear? So in capillary tube, as the name indicates, what is capillary? We have been studying the capillary. What is this capillary?
Small veins.
Minute veins.
Like
If I'm talking about physics, I'm just putting a tube inside the water, a beaker of water, and then I am telling that this tube is, the water level is rising due to capillary action. Where is the blood?
Can you repeat that, Miss?
Yeah,
You're
Miss, I
in-
didn't get that second bit. Could
You didn't
repeat?
get, that's okay. Let us talk generally about the capillary. We are poking in the hand, so we are talking about the capillary. In physics, for example, you have a beaker of water. You're putting a tube And you can see the water is rising there. Why it is rising there in the tube?
Oh, isn't it
Because
because
of
like the displacement of water?
The displacement of water due to
some other forces except gravitational forces like cohesion, adhesion.
but it's traveling
this
in
fact
minute
that-
tubes.
Yes.
That's why we call capillary. Capillary means there's some minute tube-like structure. It has its own force to suck the liquid and to make the flow of the liquid. That's where we got the name capillary in case of blood. We have minute arterioles or arteries that carry the blood and it is traveling. And when we are taking the blood using a minute hole tube, that's called the capillary force that is attracting the blood inside the tube. Clear?
Yes, capillary action.
Capillary force, capillary action is totally different than gravitational pull. Gravity is attracting towards downwards. And capillary means anything with a narrow lumen or narrow cavity is sucking the liquid. That's called the capillary. So don't confuse with this. You may come across the word capillary in so many situations. The point is, when it is gravity, it's towards downwards. When it is capillary, it can be in any direction, but the flow will be in a minute tube. That's it. Clear?
Yes, ma'am. Clear.
Ma'am, clear. Yes.
Clear for everyone? I don't think so.
Yes, clear.
Because in order
Yeah.
to avoid these mistakes, I'm telling you, capillary means something traveling in a minute tube. That's it. You recall that and remember this. Okay, next.
Excuse
Now,
me, Miss. The previous slide, the picture of the puncturing the finger, is that the right side? I mean, like, why it doesn't seem like it went into the side of the finger? The puncture
Oh.
itself.
Yeah, it has to be on the side only.
Isn't
Okay.
it supposed to be a little to the top?
Can you see the site for the puncture? Yusra, can you see this picture?
Yeah. Yes, I can see.
It can be from this tip and to the blue tip beginning to the blue tip ending. Anywhere.
Okay.
The blue color beginning, the blue color ending can be anywhere in that site, not at the top.
Okay.
Okay?
Yep.
So, next. See, they have this marked in this slide, the site where you have to poke.
Yeah, I thought it's supposed to be a little bit to the top of the finger, like the
It
one
can be
that's,
from there to a
yeah.
little bit down.
Okay.
There's no fixed marking. Okay?
Okay. Okay.
Is it clear now?
Yes. Yes.
Okay. How will you collect the blood? I told you, do not milk this. Based on this, you will be getting a question. Do not milk the site. Why? We are not supposed to milk the site because it increases the chance of hemolysis and tissue fluid contamination. Now, what happens if the blood is clotting? It means stop it, right? And then start inverting. And patient care, you know, you have to apply the thing, what do you call, the cotton and everything, label it. Clear? That part is clear. What if I'm getting a question like this? For example, if a patient who is coming to me is in blood thinners. Now, this is an added question that I'll be giving you the training to ask to a patient. We all know when the patient comes, we have to ask, have you done this before? We have to ask, are you fasting? We can ask, we don't ask, will you faint? Have you done this before? They give the information. Don't ask them, will you faint? if I take the blood, right? That's not professional question. So avoid that. Have you done this before? Are you fasting? Are there any allergies? Are you in blood thinners? According to CLSI, when you come to the SIM, then you will be learning about this. So I'm giving this as an explanation why we have to ask, because nowadays there are so many conditions in patients where they have cholesterol, high cholesterol. So when they have high cholesterol, the circulation of the blood is affected. Blood becomes thickened. They have cardiovascular issues. So the doctors give them the blood thinners as a prescription medication. They have to take this blood thinners to make the blood flow. So no clots will be formed and no cardiac arrests. So this is something which is an alarming rate. Once again, I'm telling you guys, the garlic bread that we have has high content of butter. The croissant that we buy, high content of fat. All the good fat, bad fat, whatever fat we are taking, even though we are taking with precaution, some people, they don't even care. They just eat with high buttery stuff, it leads to cholesterol, accumulation of more fat. And this happens, and this leads to the cardiac arrest or cardiovascular diseases. So because of this, there are so many patients coming with blood thinners. What is this blood thinner? It's a baby aspirin usually. If some people are not, they're not okay with the blood thinners, the doctor may prescribe some other things, some other medications. But the bottom line, as a phlebotomist, why you are asking this? Because if they are in blood thinners, if they come to the lab for a venipuncture, the blood won't stop. The bleeding will not stop like the other people. There'll be continuous bleeding. Now, the point of view as a technician to ask this question is, when you get the answer, yes, I'm in blood thinners, you give a big bunch of cotton to them and tell them to apply more pressure. The pressure should be double when compared to the normal patient. And sometimes it takes time, 5 minutes for them to stop. That's okay. You don't have to panic. You know now they are in blood thinners. Give them cotton and let them apply. At one point, definitely it will stop. And for these people, you have to be very careful, because even if they lift a small, a small bag, it will start bleeding. Tell them for 2 hours, don't touch anything. And they put the blame on you. I don't know what they did. They draw the blood and it's still bleeding. Something is wrong. No, nothing is wrong. It's the blood thinners. The medication. Clear?
Should we keep them like for several minutes to make sure that there's no more bleeding?
Yes. But before that, the pressure that they have to press here, they have to press a little bit deeper to arrest the flow of blood. And this, you may get a question, what you have to do. Apply more pressure on the cotton or give them some other thing, give them water, give them nothing. Just apply more pressure. You may get a question based on this. And this is the CLSI who mandated that is a better thing to ask before the phlebotomy. And now, we talked about everything, and then the next question is heel puncture. Now, look at the position of the heel puncture where we have to poke. Medial and lateral plantar surface of the heel. This is the medial and lateral here. Okay? So they may give in options, different things. The arch, they're near the fingers, or at the curvature at the back, or the medial and lateral plantar surface. You have to pick and you have to give the answer. And now, look at this. Do not milk the site. You have to hold the foot, and then you have to fill the capillary tube or microtiner. This you know how to do. And precautions. Look, do not puncture deeper than 2 millimeter. Now, the question can be, what is the maximum depth you can poke a heel? What is the maximum depth that you can poke in a heel for a heel puncture?
2
What is the
millimeters.
number given here?
2 millimeter.
2 millimeter. Do not puncture through previous puncture site, but this first statement, can you see this? You will get a question on this one. Do not puncture the posterior curve of the wheel. Do not puncture in the area of the arch. This you will understand based on the question when you see. And in this one, you will get 2-3 questions. Neonatal screening program. Why we do the neonatal screening program? Now we know, to find some disorders or diseases as an infant, right? And second, what can be the age of the neonat to collect this in a normal situation? What should be your answer?
24 to 48.
24 to 48.
24 to 48 hours. If the question says a child is born and that the baby is in the intensive care unit, what do you call the NICU, which means neonatal intensive care unit, till how many days you're allowed to collect the blood?
7 days.
7 days.
7 days. That should be your answer. Look for the options. Okay. Now, this is only a screening test. Based on this, they're not going to start any medication right away because still it's a newborn. But they will monitor, or they will tell the parents to observe the child for any different situations. And maybe for every 2 years, they will tell them to bring the child to monitor the development, to prevent certain things where the child has to suffer or go through, because it is a condition that is related to the brain function. And it is followed by the physical function. There should be some adaptive things that they have to learn, or the parents have to have a different approach when dealing with this type of children. Maybe they can go to the special needs. Maybe they need some other equipment to help them to function normally. Not only all these things, that the child herself or himself has to develop the confidence to survive in the community. That's very important. Majority of the children, when they end up in these situations, they go in depression because of the lack of the capability to cope up with the situation. They need more help. That's why they have started this program, and this is really, I would say, this is a breakthrough in the medical history. It's a big challenge to raise a child with disorders, especially when it comes to the intellectual levels. It's not easy. Okay? And thank God we have these facilities nowadays. In olden days, when I compare, olden means not like 100 years ago, I don't know about that. In my period of development or growing, what I have seen, so many people have suffered because of this lack of facilities, lack of understanding, lack of giving them support. And it's not their fault. It's something they have been created naturally. They have been born like that. So they need the support. They need attention. They need help. As human beings, we have to help them. Clear? So 2 questions and 1 more question. How will you fill the card? You have to cover the whole circle. Okay, that's the correct procedure. What will happen if the circle is not filled? What will happen?
Insufficient amount.
Insufficient, NSQ, not sufficient quantity, rejected. Okay, now another question. For how long this has to be kept? At what temperature?
3 hours.
Room
and-
temperature.
3 hours room temperature. The options will be given. Immediately it has to be kept in the freezer, in the fridge. Temperature 45 degrees, temperature 21 degrees, and 2.5 hours, 3 hours, depending on the wordings, depending on the questions, you have to apply your knowledge and then answer it properly. Clear?
Clear. And
Yes.
excuse me, for filling the circles, what if it's overfilled, the circle?
They will tell you to take another one. It has to be, it will spread. So I think you put one drop, it automatically spreads. If the drop is too little, it won't be filled properly. That's a technique. You will learn.
Are we going to practice this?
No, we are not hired in a, we don't know. We are not going to be hired guaranteed in a pediatric division. If you apply in different places, they will train you.
Okay.
Right?
Okay.
The college covers the basic concepts, but if it's some specialized things, we don't do, but you will be trained. Okay? And this one, this whole card is important. First, what you have to check when you pick a card for neonatal screening, expiration date. As we have learned, expiration date is considered an important thing that we have to check as a technician. It could be for reagents, it could be for the tubes, it could be for the needles, band-aids, even cotton. Sometimes they give the expiry date. I don't know why. All these expiration, you have to check. Okay? The patient is not going to die immediately or nothing like that, but the test results will be different. Why bandage? Maybe if the bandage is not up to the time limit, there may be some allergies, irritations of the skin, or it won't be effective, something like that. It's nothing a panicky situation, but as a technician, the patients who come may object, they may make it a big issue. You have to be careful. Of course, when it comes to the tubes, it's very critical because the results won't be accurate. Right? Why I'm talking, you're not talking. Even if I ask yes or no, no one is telling yes.
Right.
So I'm not talking today.
Yes.
Yes, ma'am.
Clear, all of you?
Yes,
So
ma'am.
look at
Clear,
this.
ma'am.
Look at these points. It should be filled. The nursing station may have already filled out the patient information. They will do that. So you have to, as a technician, if you go there to do this screening in a card, check for the expiry date on the card. And also the nurse who is associated with this during the delivery, they will be writing the name and everything. So you as a technician go compare the ID. Is the ID in the band of the baby and the name written on this card matches? You have to check before collecting the blood. And this you will get an important question. What is the usual identification procedure in a hospital to confirm the ID of a patient? Look at the wordings. And the options will be checking the band and then taking the blood. Why the band, the wristband? Because it has the information about the patient. What if the patient is sleeping? You will go wake him up. Hello, can you tell me your first name, last name, please? No. If the patient is sleeping, just don't disturb them. Check the wristband. Document it. If the patient is unconscious, hello, can you just talk to me for 3 minutes? Then you can be unconscious because I have to take your name. No, it's not possible. Right? Either the nurse who are there has to say, but you have to document the nurse said this, I checked. If no one is there, everyone is busy. You are working in a hospital and you are the technician. You're going to draw the blood. What will you check? Sometimes when you enter, the door has the name of the patient, but we can't rely on that. We don't know whether it's an old patient, a new patient, fresh patient, just admitted patient. So always, when you're working in a hospital, check for the wristband. Right? That's why when you enter, immediately they put a wristband. Yes, Eveline.
I was working as a PSW in Trafalgar Hospital, and one assistant came in. The armband is on the table because the patient has mental disability.
Oh, okay.
Yes. And so the technician came in and she asked the nurse,
Mm.
where is the armband of the patient?
Mm.
And the armband is on the table. So the technician, the assistant says that I can report you to
Yeah,
your because
it
the
shouldn't come
armband.
out.
But then in that situation, because the patient is really, she will remove the armband. She
Yeah,
doesn't
this
want. She
this
does. It's
this
not comfortable for her. So
for her, yes. It's
yeah.
not a
So
normal condition, right? Even if she reports,
exactly.
as a technician, yes, she has to report because there'll
Yes.
be an identity crisis here, and then it may end up in wrong identification, a wrong draw of blood. Yes, she should be aware of that. But look at the situation. Even we are trying to do something to those type of patients, but they're not aware of that. They're not aware of the consequences. That's the reason why they need help. This is one situation. When you go to hospitals or settings where there are people with mental challenges, trust me, it's not at all easy. It's not easy. It's not a joke. It needs more energy. It needs more patience. They need more help in a different way. And also, these type of patients, they like only some people. They don't like everyone. Sometimes you may be drawing the blood the first day, the next day when you go, they will tell go away.
Yes. True.
Something they don't like it,
True.
but they don't know how to express.
Yeah.
Maybe you looked at them in a way it's very scary. For them, it's scary. Maybe the way you draw the blood, they're not comfortable. So
Yeah.
in
Especially
these
for
situations, yeah, they
patients.
resist. They
Mm-hmm.
resist badly. So in that
And
situation, when there is a caregiver, tell them to pacify them. If they don't listen, just tell some other technician to do the job because they won't cooperate. It's not their fault. Their brain chemical says, tell them to go away. You have to go away, period. In certain situations, when they have no choice, if the doctor is there, if they say, I don't like this doctor, you can bring another doctor. That's not a situation. They will convince, they try to do the thing maximum for us. It's a doable thing. If another person is coming whom they like, they are comfortable, let them be happy, let them be comfortable if it is possible. Clear? It's a very different, difficult situation. I have observed, I have seen. Always feel bad for this type of, individuals because they need help and people try to ignore their best to this type of people. This is where the service has to be done as a human being, and this is where people ignore the maximum. And me personally, I don't like that. I want to help this type of people because when people are already good, when they know how to do, they manage to do. And we run after the people who are really good. It's become a trend. Only few people they think about these situations and they try to help them. Show empathy, be kind because it's not their fault. Clear?
Yes, ma'am.
Yes,
Clear.
clear.
yes,
So
ma'am. Clear.
because you're going to be the healthcare professional and then you will come across these type of individuals a lot, right? Show
That's
empathy and
right.
show your kindness, everything to them. They deserve
That's
it.
right.
Okay, so this one, the nursing station. Okay, now do not touch the filter paper. What are the don'ts in the card? Do not touch the filter paper and do not touch the filter paper into the bench because the bleach will affect the test. Okay, so these points you have to pay attention. Fill all spot fully so the blood penetrates through the back of the filter paper. So here, once again, they won't ask in detail how the blood is going to penetrate, but they will tell you, do not touch the bench, do not use your hand to touch, leave it in an area where it has to be the temperature should be a room temperature for 3 hours to dry up and then give it to the technologist for testing. Yes, Hasinath.
So, Miss, if you do not touch anything, so how do you transport it from one place to the other?
Which one?
The card, the paper.
The card you
How
can
is it?
touch.
It just sit there to dry. That's it. When you
The
don't
card
touch
you
it.
can touch in the area that
Mhm.
is mentioned, not in the filter paper area. That's for
Okay.
the testing. Okay.
All right. Thanks. Yeah.
Do not
Okay.
layer dry drops of blood. If already you have collected for long, you just forgot and then don't put it. Put the fresh blood. Okay? So these are the things you have to take care. And after collection, allow to dry between 15 to 22 degrees. So usually the room temperature is 21. 22 is also okay, but the range is 21 to 25 usually. But you have to circle when it is given 15 to 22. If they ask you the question, what should be the temperature for the drying of the card? If the option is 22, 23, 24, 25, 21, pick 22 because it's mentioned here. For how many hours? 3 hours. Yes, Asinath, you have one more question?
Oh, no, sorry.
Okay.
Get it.
So keep away from direct sunlight. This is one thing. Why you have to keep away from the direct sunlight? Because there may be some changes that will be happening, so the tests won't be accurate. When they say don't do this, it means don't do that because there is something that they are looking for and they may not be finding that. And this will result in the false, false diagnosis. And the test results won't be accurate. So you have to be very careful. Any questions? No, yes, Miss.
No, miss.
Okay,
No,
let
thank
me
you.
ask a quick question to you. According to CLSI, what is the maximum depth for a lancet puncture during a capillary collection on a neonate foot? 1.5 millimeter, 2 millimeter, 2.5 millimeter, 3 millimeter.
2
millimeter.
point millimeter. 2.0 millimeter.
2.00 millimeter. Okay, keep this in mind. And based on the capillaries we have seen, I'm going to ask few questions because next we are going to the syringe. Okay. The phlebotomist is going to perform a capillary puncture, okay, on a patient. Which is the acceptable site for this puncture? Look at the options. Thumb. Is thumb okay?
Not okay.
Not okay. The earlobe okay?
No.
No.
Through a previous puncture okay?
No.
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 Side of the middle finger okay?
Yes.
Yes.
How many of you yes? How many of you know? Everyone has to talk, please. This
Yes.
Did you
is
say
called
Yes.
Side?
Yes, yes.
yes. Agreed? Side of the middle
Yes.
finger. I agree. Okay. Now, medical term for fainting. What is the medical term for fainting?
Syncope.
Syncope. So, edema, syncope, emesis, iatrogenic, syncope. You gave the answer. Why do you think the phlebotomist has to warm the site before the capillary puncture?
To encourage blood flow.
To increase more blood.
Increase blood flow.
All of you agree with this?
Yes.
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 Let me read the options. To decrease blood flow to the area. No, right? You won't agree.
No.
To avoid the need to milk the puncture area. You don't have to milk the puncture area. That's why we do this.
No.
No. To increase the blood flow to the area.
Yes.
To make the patient more comfortable.
To
We already
increase
know the
blood flow
answer.
to the
We
area.
already know the answer. Yes. Now, we have the adaptive technique. Okay, now, what will happen if you are milking the area or the site following the capillary puncture? So you do the puncture. Now you're milking the site. What will happen? Look at the options. It increases chance of hemolysis of collected specimen. Specimen becomes more icteric and appears brown. Okay. So you cannot hurt the patient and there won't be any bruise, or it will decrease the glucose of the collected specimen? What should be your answer?
Increases chance of hemolysis
Increases
of
the
collected
chance of
specimen.
hemolysis of
Hemolysis.
collected specimen and also contamination of tissue fluid. Two things you have to look for. Okay? Good. Let me ask following the, okay. A patient who said, a patient is coming and you're going to do the phlebotomy, but you're going to perform, you decided to perform the capillary puncture. So a patient who said they fainted during their last routine, last blood collection. So you think the patient doesn't have to lie down now to collect the blood?
No.
True or false? Is it true or false?
False.
False.
Understand my question. A patient is coming there, and this patient is a routine patient for blood collection. And the patient says, last time when they did, I fainted. And now you're looking for the vein is bruised, and then something is not right. You cannot find it clearly. So you are deciding for a capillary puncture.
Mhm.
Now, do you think the patient should be lying down on the bed for this puncture? That's the question. True or false?
Yes, true.
Yes.
Yes.
True.
Yes.
For the capillary puncture?
Yes.
Yes.
Okay. Why do you think so?
Because the
The risk
patient
of
might be
fainting.
afraid of the needle too. And
Yes.
so
Yeah.
you have to put the patient into that ergonomics position just in case for fainting.
In case if they see the blood. Okay. So you say they have to lie down, right? No matter what.
Well,
Yes
yeah,
or
if they
no?
have a history of
Yes.
fainting, yeah.
Yes.
Yes. But the question says they don't have to lie down. So is it true or false?
False.
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 Okay. So for the capillary collection, you're using a microtainer tube. Okay. And will you follow the same order of draw as you do in the ETS system?
No.
I was gonna ask you that, Miss, actually. What is the correct order of draw? Because I was looking through the PowerPoints and, well, let me find it here.
It's not
And
the
they
same.
don't specify the
It's
order
dead.
exactly. They just say blood gases followed by some other stuff. Hold on.
I'll explain it to you based on some questions that I have chosen. If they say, will it be the same order of draw? The answer should be no.
No.
It's not the same order of draw. Okay? Now I'm going to ask you a question based on the slide that you have seen. Which of the following capillary collection containers are in correct order of draw? Again, listen to my question. Which of the following capillary collection containers are in correct order of draw? And I mentioned which system that you're going to apply for collection?
No. Capillary, yes.
Capillary.
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 Capillary. I never talked about the vacutainer tubes. Vacutainer is the one we call the evacuated tube system, ETS. I'm talking about the capillary puncture. Now look at the options. The option goes like first will be the serum, other additives, and EDTA. Is this correct?
No.
No.
EDTA, serum, other additives. Is it correct?
No.
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 EDTA, other additives, serum. Is this correct?
Yes.
Yes.
Yes, that's
Yes.
it. That's it. According to the slide, blood gases, they're not even mentioning. If you get a green tube, the green, EDTA, other additives, serum, yes, it is correct. But because I told you for the blood gases, it's a stat. Anything stat is for the PST is green. still we follow the same procedure. Even in the hospitals, the immediate thing they look for has to go to the stat. They come with a green tube. That is according to CLSI. But here the tube is not mentioned. Here the answer is mentioning EDTA, other additives, and serum. But it's a reverse order. That's it. EDTA, other additives, serum. Clear, all of you? Yes, Amina?
Yes, in addition to what you've said, is the order of draw. If you don't understand those statements, just go through the other attachments in the PowerPoint, like the next slides, you will get the BD microtainer picture with the order of draw and the inversion times and all the information you need about it. It's there. Go through your slides, like the following slides that comes after. What's it called? The next page. Yes, like I think the third page after
The
this.
next page, yeah, they have given.
Yes, they've given it the
So
pictures and the explanation.
The starting tube will be the lavender,
yeah,
then the pink, and then there'll be other additives. At the end will be the serum. That's what she's mentioning.
exactly.
Okay, clear now? Clear, all of you? You know,
Yes.
Amina, they are thinking, never mind the slides, just tell us the answer. Tomorrow is a test.
Fair, miss. It's clear.
Right?
Let's go to the next.
We don't have time to go through the slides. Please, miss, tell the correct answer so we can follow that tomorrow in the test period. Okay?
No, miss, you can go to the slide.
Okay, oh, thank you so much.
You're welcome.
Okay. Now, for the pediatric patients, you'll be getting questions. For the geriatric patients, you'll be getting questions. Let me bring some other question pertaining to the capillary puncture. Okay, an outpatient. Now, look at this. Why I'm telling about the blood thinners, the CLSI has mandated asking about the blood thinners. When you come at the end of the course, I'll be there teaching the SIM. You have to come to me. Hopefully, I should be there for your SIM, even for your batch. So in that SIM lab, I explain everything about the phlebotomy again in detail because that's where you are going to jump exactly into the practicum side after that. So it's my duty to explain some of the other concepts. This is one main thing. Based on that, there is a question. An outpatient tells their phlebotomist. You can be the phlebotomist there in the hospital, but it's an outpatient. They are on blood thinners. Okay. And prior to the collection, they are telling, you know, I'm taking blood thinners. I'm not allergic to anyone, but I'm taking blood thinners. What will the phlebotomist have to do following the procedure? Now look at the options. Have them raise their arm over their head like this. Bring the hand to the top to do the blood collection. So how will you collect the blood? By standing on a stool or a ladder? No.
No.
That's not a possible thing, right? So ask the patient to remain for an additional 15 minutes to ensure bleeding has stopped.
No.
No.
That's a
Apply
possibility.
additional bandages to the puncture area.
No.
Yes, that's okay. Cotton.
No.
You need extra cotton.
Apply pressure on the puncture site
Yes.
longer to ensure bleeding stops.
Yes.
Ensure bleeding stops.
Yes.
Yes.
That's the correct answer.
Clear now?
Clear.
Yes, clear.
Amina, you have to mute. If you're not talking, mute, it's echoing. Sorry. Okay. Now, can you imagine how the questions will be asked? This is something that you have to keep in mind because you'll be doing the same in the practical site. If you come next week to the lab, you can role play. You can role play as if someone is bleeding for long, taking blood thinners. If you ask, they may pretend, you may show them. This is a possible way of learning. I would recommend you bring volunteers. I think when Munmun comes, she will also encourage you to bring the volunteers because every time poking your friends, your hand, you have learned that experience now. You need some new hand. Okay? Now, any questions regarding this, because we are going to do the revision for the syringe? Yes, Asineth.
Miss, when can we bring the volunteers? Is it during the week when we have class, or are you guys open on the weekends, or when can we do that?
During that 4-hour period, when you are in the lab.
Okay, thank you.
We are not paid extra for to be in the college. You may come, but only your volunteer will come. No one will be there. Clear? Yes, Varna. What's your question?
Just asking.
Okay, no
I have a
problem.
question. I have a question with regards to the venipuncture for the patient. What is the possible cause of the pain when a patient complains of rotating pain up and down in their arms?
Up and down in the arm, you pinch the
when the
nerve.
needle goes in.
The nerves.
You pinch the nerve. It
Hit
can
the
be a
nerve.
lavender needle, it can be some other needle, it can be multicolored needle, whatever it is. The person, they never palpated the vein. Remember one thing, if it is a proper vein, if the needle has entered inside the cavity or lumen of the vein, you won't feel anything except the prick. You won't feel nothing. But if it is little bit ouch, it means you went to the border of the vein. If it is more ouch, like a crazy pain, it means you touch the nerve, and that's it. Pull it immediately outside. Release the tourniquet, pull it outside. Okay? But it's a good question. We get these type of questions often in the tests. Now, another question. We talked about the foot, right? What location of the neonat's foot is acceptable to collect the blood from? Can it be a large toe?
No.
The
No.
medial.
Can it be the arch of the foot?
No.
Can it be the posterior curvature of the heel?
No.
No.
Can it be the medial plantar surface?
Yes.
Yes.
Medial
Yes.
or lateral? Both you can. Yes,
Yes.
Azina, still you
Medial
have a
lateral.
question?
Medial and lateral plantar.
Yes.
Yes.
You have a question, Asinat, still? Okay, good. Thank you. Any other question, Miss? I want to know this. I want to know this. Anything like that? It's good that you are focusing, asking questions. I appreciate it. So these are the possibilities and from the slides that you will get questions from. Okay? Clear?
Clear, ma'am.
Yes,
Okay.
clear, ma'am.
Let us proceed with the this syringe. So we all know there is one system called the syringe method, and you have this in the phlebotomy essentials as a resource. The routine practice is applied to blood collection. Proper PPE you have to wear. Okay, everything, hand hygiene, the same safety goggles. If you want to wear, you have to wear. And now, never touch or handle a filled tube without gloves. If I happen to see anyone picking the tube and bringing it to me, miss, is this okay? Then immediately 10 points cut. In the practicals, if you do this, even if I've done the proper procedure, everything, I'll give 0. I will give 0 because it's a big no, because you're not following the safety protocols of the lab. According to CSMLS, according to MLPAO, safety is 0. So without safety comes first. Without the safety protocol, you can't do anything. Now, steps are the same. Introduce, everything is the same. You tie the tourniquet and apply the alcohol. You recall the venipuncture, everything is the same. But why a syringe? Miss, why a syringe? I'm not making rules, right? So the CLSI mandates if patients, they have fragile vein. Look at the word, how they have coined the word fragile. What is fragile? It'll break. What is fragile? Usually we use the word fragile when it comes to glassware. When something is shipped from one place to another place, it'll be written
Very
fragile.
delicate. Very delicate.
Very delicate. That's what I mean to say. Very delicate. Good job. So if they are very delicate veins, and these words, you have to keep it in mind, it's very important for the exam point of view. You may get the same words. Fragile veins are easily collapsible veins. The question can be, which blood collection technique will you use as a phlebotomist when a patient has fragile veins or collapsible veins? Then what should be your answer? A, microtainer, B, capillary, C, syringe, D, ETS. What's your answer?
Syringe.
Syringe. Okay. So in this case, when you're collecting using the syringe, can the needle be directly attached to the syringe? Is there any possibility of the needle directly attached to the syringe?
Yes, ma'am.
Yes. Right?
Yes.
If it
Yes.
is manageable, if the veins are okay.
That's right.
You cannot handle the veins. It's a very, very fragile vein, but still you're going to try using some other thing attached to the syringe. What could that be? Look at the second one, an additional device to assist with accessing the small veins
The butterfly.
is using the
Butterfly.
butterfly needle. So you have both the
Mhm.
options. So while reading the question, read it properly and look for the words as fragile veins, easily collapsible veins, and also for the accessory attachment, the butterfly needle. Both are possible. Clear?
Yes, ma'am. Clear.
Now look at this picture. This picture looks so easy. Sometimes in the test or exam, they will give this picture. They will tell you to just pick the parts. So keep this in mind. This picture is important. In the exam, they will tell you to pick the parts and label it. So what is the bottom one? The plunger. You know, the one that is in between. Okay, just above the plunger till the hub. Hub is something that's used to hook with the attach the syringe with the needle mainly. This part is called the barrel. So this is barrel. Now keep and record this picture in your mind. So barrel, and this is the hub, and this is the needle. What is the tip of the needle where you're going to poke? What is that called? There will be a small hole there. What is that called?
Bevel.
Bevel. So all these things you have to memorize. So once again, record this picture: plunger, barrel, hub, needle, bevel. Clear?
Clear.
We're good.
All good? Okay, now I will be asking you a question. What is this part of the syringe where you have control to bring to move
Plunger.
in and out?
Plunger.
That's called the plunger. Now, when I ask you a question, I'm sorry guys, I have irritation in my throat. What is the part of the syringe where blood is collecting?
Barrel.
Barrel.
The barrel.
What is the part of the syringe where the needle has been hooked or connected?
Hub.
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 What is a small hole in the needle where you're going to poke the patient? What is that
Bevel.
called?
Bevel.
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 Clear this one? Everyone clear?
Clear.
Yes, ma'am.
Alexia, Amina, Asinet,
Clear.
Chris, Sarina Main, Eveline,
Yes, ma'am. Clear.
Oda, Joanna,
Yes, ma'am.
Clear.
Kara,
Yes, ma'am.
yes, Luis, Maris,
Yes, ma'am. Clear.
Rugiato, Santiago. Yeah, this is to
Yes,
make
clear.
the students wake up, even if they are physically present there and dreaming about the test tomorrow. Okay, Rugiato, Maris, Santiago, Shabana, Verna, Inghong,
Clear.
Yusra, Zineda.
Clear,
Everything clear? The concept is clear because I don't want you to
Yes,
lose
it's
marks
clear.
if you get these type of questions. They're very easy.
Yes, it's clear.
Now
miss.
the barrel size. 10 ml and 20 ml is most common in the lab. So again, based on this, you will get a question. Now, what is this lure lock? Miss, what is this? First time you're hearing this? It's nothing new. This is, you know, the adapter that we have while during the venipuncture, the yellow colored with the green, that's usually called a lure lock, a lure adapter. So you can see that in the syringe as well. So you can insert the syringe. And what is the common, how much you have to collect the blood? 10 ml and 20 ml, right? And size is based on the required amount of blood you're going to collect. Now look at this. This whole slide is important. As I told you, for the parts of the syringe, you may get a question. Okay, size is based on the required amount of blood you require for a collection. That is done. Look at the third one. For example, this example question, you may get it. For example, you need a PST. PST means what? Which color tube? Blood
Green.
gases, blood gas, green. I told you
Green.
blood gases,
Green.
green, stat, green, PST, green. When you get the word PST, green. Stat test, green. Blood gases, green. EDTA and sodium citrate. So you're going to collect 3 of them. Okay, 3 of them. Now, but while following the order of draw, which one should be first? After collecting blood in the syringe, you have to put this in the tubes.
Yeah.
Evacuate tubes.
Sodium citrate.
The first one
blue.
should be blue. The second should be?
The PST.
Here it's a PST. And then?
Yes. And then the EDTA.
EDTA. This you shouldn't forget because you're going to again transfer this blood in the different tubes, the ETS tubes, right? Because the veins are fragile, you're not directly using the tubes to suck the blood. That's why we are using the syringe. But here, this is very important, the measurement. Look at this. 4 ml EDTA, 4.5 PST, 2.7 ml sodium citrate. What will be the total amount that you have to collect? 11.2 ml.
11.2.
We learned 10 ml and 20 ml is most common. So which one will you pick? You may get questions like this. They may give the volume, they may give the different tubes, and now they will tell you from the options, which one will you pick? Or how much blood will you collect? 10 ml, 20 ml, 15 ml. So usually they say 10 to 20. So which option you have to pick?
20 ml.
20 ml is the
20.
best one. 20 ml. Now prepare for collection. You know what to do. Needle, size. This we don't have to repeat this again and again. You know this. I assume you know this. Yes or no? We have done the blood collection. These steps are the same, right? Now loosening the plunger. This is something important. What if when you're using a syringe, the plunger has a rubber ring? It's like made up of plastic, and most of the time it is stiff. What is the first step you will do when you are going to use the syringe? You have to just
pull the
pull the
plunger
plunger
on and off.
and
Yeah.
then you have to just do this technique, whether it's loose, whether it's too tight, because when you insert the needle, you cannot do the pulling part there and it's very tight. Now the patient is looking at you and now he will think this is a dangerous technician. Why? When you're pulling there, the needle will also come out. When the needle is coming out, you won't get the blood, and then there will be added blood coming out because the tourniquet will be there. So you will be focusing on pulling and balancing the needle inside, but you may forget about the tourniquet. But this is generally, it's not a good example for a technician. After insertion, pulling the plunger is not a good example. It's a very bad example. We don't want those mistakes because it may lead to needle stick injury. It may the patient may become more anxious, and you will not be collecting the blood, period, because of this situation. Even with the butterfly needle, if you're going to use the butterfly needle, when you open it, make sure you just lightly stretch the tube. The tube is very delicate and minute, so please make sure you just straighten it. Because what happened, this has happened. You insert the needle, you'll be focusing on the blood flow, and then what will happen, this will curl. It will become a coil because you never stretched properly. And when you're stretching it, the needle comes out and then accidentally it's pricking the technician's hand. We have more things to do in that case. First, focusing on your blood, focusing on the tourniquet, focusing on the patient's blood. And after this procedure, additional procedure, bring the file, injury report or incident report, bring it out in front of the patient, or in front you call someone, because now it's an injury for you. You don't know what has entered inside your body, your system. Above all, contamination. Now your brain, you know something about the viruses now. Your brain will be thinking, now what virus has entered in my blood? You will forget everything. You'll be focusing on yourself. It makes sense, right? We are all scared. So safety. Now you have to fill the form in front of the patient. There should be a witness to sign. That has to be signed by the campus director. Now the campus director will question what happened. You can say, I'm learning. Okay. But I can't say they are learning. I was just watching. Do you get this? Clear?
Yes, ma'am.
I can't say, sorry, I was just watching. I have to train you. That's why I'm telling this. And some incidences have happened like that. In our lab, no, but outside lab, yes, I have observed. I always tell them, just straighten the tube. Even the flow of blood won't be proper if it is coiled. Some of them, I told in the previous batch to just stretch. One student stretched its, like by putting all her strength. What happened? The butterfly part came out, the tube came out. And remember, these are very delicate, handled with delicacy. Clear, all of you? So you may be getting questions based on this, how to handle. Okay, now hold on to the barrel and move the plunger up
Yes,
and
I have a
down. Put the
question.
plunger. Yes, Azinet.
I have a question.
Yes.
So for loosening the plunger,
Mm.
what you're saying is that is it better to take the plunger out?
If you are trying to pull the plunger, no, you don't take it out completely.
Yeah.
It won't come. It will stop when it comes to the end.
Okay.
The people who manufacture, they have all these things in their mind and they have designed accordingly. Imagine you are collecting the blood. If the plunger is coming out, the blood will be coming out. So they don't make manufacture like this. It will stop at the end. My point is, you cannot play with the tightness of the plunger when the needle is inside. It's not safe. Got it? If you feel it's very tight, you don't have the control of your hand on the plunger, take another one. Then when you have time, play with it, whether it goes inside out until it is loosened. You understand what I mean? Yes, Amina?
I didn't know that aspect, but I just wanted to say, like, she means that you should prime the plunger and the syringe. Prime it. Like, you're testing, in, out, to loosen it before you now put in the correct position with the needle, before you now insert it. So just make sure it's flowing freely before you insert it. That's what she's saying.
Yeah. But have you seen, even while giving the, I don't know, but the vaccinations, when they give, they have super duper needles, but generally for injections, nowadays we don't have injections. No needles now, but when we grew up, for everything there's a needle, antibiotic needle. For any vaccination, needle. If the child is not eating, needle. All those things, we grew up with needles. I mean to say, I have seen needles given to the patients frequently. And majority of them, they end up in contamination, some sort of pus formation on the site. And those days, things were totally different. Now we are blessed with so many situations disposable. Everything disposable. Shops. Better control for in terms of safety and contamination. So, but don't worry, everything will be taken care. Just use your flexibility with your hand when it comes to the plunger. That's it. That's what I mean to say, because you will come across all these situations. Now, where we are, okay, venipuncture with syringe. Tell them take a deep breath, be well up. Now, once again, this angle is important. Be smooth and quick. Okay, ask the patient, open your hand. This you have to practice. Then ask the patient, how are you doing? Okay. If your needle is nice and secure, briefly glance at their face. Even though you're pricking, just see, look at their face, look for signs of stress. So now you may get a question. If a patient is going to faint, what are the physical changes you can see? The physical changes can be, they will be just closing their eyes, or the head will be moving a little bit, or you will have a muscular twitch, and also sweating, pain. So in this situation,
Yes.
will the pallor, sweating, or pain could be a reason for fainting? Not necessarily. They are in stress. That's the indication. Sometimes you will get a question. What are the signs of stress you can observe in a patient when you perform the venipuncture? One can be pallor, one can be dizziness, one can be emesis. So you have to make a better choice. Clear?
Yes.
Yes, ma'am.
Now this is slowly pull back the plunger. You will be just controlling the pressure, everything. A tourniquet 1 minute. We know this by now. Tourniquet 1 minute, we all know. Now how will you do the cleaning technique? We know how to clean. Now look at this point. This you may get a question. How? When you are transferring the blood, we all know we have to transfer the blood from the syringe. Yes or no?
Yes.
We all know.
Yes.
How many of you still don't know that we have to transfer the blood from the syringe to the tube? The wrong question, right? We all know. Okay. Now, why we have to transfer? My next question.
There's no anticoagulant.
Additives.
Yes, additives. Why? Because we have to maintain the blood with free flow, because we have to perform different things. Yes, good job. So we all know. So immediately we have to transfer. We have to follow the correct order of draw. So my question, so which type of tainers will you use? Will it be the vacuum tainers or micro tainers?
The vacutainers.
Vacutainers, very good. So which order of draw will we be following? The serum, additives, and the EDTA, or EDTA, additive, serum? Which order of draw will we will be following for this?
The serum, starting from citrate,
serum,
additives, and
serum, additive, because it's a normal, regular. Okay, regular thing. Good. So this you have to keep in mind. And while transferring, look at the picture. This is what we call the lever adapter, the yellow color thing where you have the button here. This is the adapter. This is for safety reasons and to have a good control while transferring. We cannot insert the syringe directly inside a vacutainer tube. We have to bring the tube inside the adapter, and then we have to poke, and then we have to release the blood in that, and then you have to keep it. And if you have to mix it, you mix it properly with what? What is this called?
Gentle inversion.
Gentle
Inversion.
inversions. Very good. And once collection is done, remove the needle from the patient's arm. You know what to do. Engage safety device immediately. So even for the needle tip, there is a safety device. You have to follow that properly. Place transfer device onto lever lock end of syringe. Turn vertical so blood will flow. We know how to do this. Then mix well, and then we have to discard the needle. Then gently make up and down, and then you have to label in front of the patient. Don't let the patient go. Document the date, time, initial, everything, record. Now, check tubes with patient. So, according to 2017 CLSI, question. This is a question slide. New CLSI guideline is of 2017. Compare the label tubes against the patient. We talked about it. Remember, even in the previous unit, we talked about it. What you have to do. It is a must. It has been mandated to avoid the pre-analytical error in the lab flow by checking the ID of the patient with the patient's wristband, or have the patient verify the information is correct. So you may be getting two options. You will check the wristband or you will ask the patient about it. So both are correct. But if it is in the inpatient setting in a hospital, pick wristband. Don't expect the patient to talk. It's an inpatient. Already the patient has been there. The patient is admitted. There will be an identification mark there. What is that? That's something to identify. That's the wristband. What if you don't find the wristband? You have to report. There'll be identification problem. Everything will become a problem. Accessioning will be a problem. The number given to them will be a problem. Immediately they have to print another band and then they have to put it on the patient. It's very, very important. Because of this lack of identification in a proper way, many errors have happened before this. That's why they took a survey. They took the initiative that this is something we have to follow. Clear?
Yes, clear.
Okay. This is an easy step to ensure all tubes are labeled correctly before heading to the lab. 2 seconds of double checking the tubes, and they have given this in red because this is something very important. You will be getting questions based on this. Period. So 2 seconds of double checking the tubes are labeled correctly can save hours of troubleshooting. Now look at this. No label, no band. We walk to the station there, and then we have to report. They will write it. Now they'll be running to check what happened, and the nurse will be informed. Now the nurse will be in trouble. She has to tell what happened to the patient. And then there'll be a big situation where they have to document it, they have to put it in the system, and then they have to check the patient all the time. So it's more work. So save hours of troubleshooting in the lab or having a patient receive incorrect lab results that can compromise their treatment. Who knows, someone needs immediate treatment and that treatment will be postponed or delayed for another 2 years and the patient will be gone by the time. So we don't want these things to happen. We want to save the patient. That's the reason why this is very important. You will be getting questions based on this. Now the checkpoint, what does it mean checkpoint? You have to check for 10 seconds. Now this is important. They have given it in block letters. 10 seconds looking for bleeding. So if they ask you for how many minutes, you have to look for bleeding. And then or how many seconds or what is the time limit to look for the bleeding in normal situation? 15 seconds, 30 seconds, 10 minutes, 5 minutes, 2 minutes, 10 seconds. Which one we have to pick?
10 seconds.
10 seconds. Okay. If still bleeding, the phlebotomist applies pressure for another. So always the bleeding site has to be monitored If it's not stopping because of blood thinners, not a big deal. Apply more pressure and take more time until the bleeding is stopping. Once bleeding has stopped, apply bandage or tape or clean gauze. Good advice to give. Again, they have given this in red, which means this is important. Based on this, you will maybe getting questions. What advice you can give it to the patient after the venipuncture? A, drive safe. B, take care of yourself. C, goodbye. D, don't leave the bandage on for next 15 minutes and do not carry anything heavy for 2 hours. Which one will you pick?
Leave the Band-Aid on and do not carry anything for 2 hours.
Clear how they may
Yes.
ask questions? This is how they generate the questions. Clear, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, now clean up. You know how to clean up, discard the garbage items in the proper disposal containers. Where will you dispose the cotton with the blood?
Biohazard.
Biohazard bag.
By the Stericycle red bag, right? Where
Mhm.
will you discard the needles?
Sharp
Sharp
containers.
Sharps.
Yeah.
Container.
Now look at this in this slide. When you're in a hospital setting, you become a technician and then you have collected the blood. What you have to do the next step? Whatever you're moving from the surrounding of the patient, it could be a dinner table or a bed rail, bring it to the original position. Because the patient may not be having that much energy, so they may be starving, so they have to eat. And second thing, if they are on the bed, sometimes accidentally they move, they don't have a balance or a control, they will come down. Then the next question, who entered the room recently? I mean, the last time. When you say, yeah, at what time you went inside? 10:30. The nurse is entering 10:35. The patient is down. Why? Because the rail is not fixed properly. Then, hello, XYZ, where are you? Can you come? Then the XYZ has to go there, and then they will ask you at what time because you are documenting the time. Remember, as a technician, even if you say don't know, they will pull. Okay, at what time you entered? 10:32. The patient is down 10:35. Did you do something? Yeah, we did something. We never checked. So the patient is now down with another type of injury. It's a big no, no, no. So please, this type of questions you may get as a case scenario. Disinfect area, remove gloves, perform hand hygiene, everything. An alternative syringe collection is the one we attach a butterfly needle and then we collect it because butterfly needles are they considered the best for the fragile veins. Okay, one tip I have given, you have to slightly stretch the thing for the butterfly collection. Another tip I'm giving you, when you collect the blood using a butterfly, when you come to the lab, the flow of blood through the butterfly will be very, very sensitive. It's very delicate. So it will flow properly when you bring the tube a little bit down. If you're keeping the tube at the same level of the hand, it may come slowly or sometimes the blood flow will stop. You have to poke again. So better gently bring the tube down to the hand level. The flow will be good. This is another tip I'm giving it to you based on my observation and experience. Clear, all of you?
Yes.
Yes.
Okay.
Yes, very good.
Yes, thank you.
Yes, for delicate veins, collapsible veins, again and again I'm repeating. And remove the butterfly needle. And okay, now when it comes to the butterfly needle, there are different types with different sizes. We have 21 gauge, we have other gauges as well. So we will check in the lab which one we are having. One is the blue ones, the other one is the green ones. Anyways, they're very delicate to handle, but in some butterfly needles, there'll be a black button. When you remove the needle, the safety thing is immediately you press the button, the needle will retract inside. It will come inside. In some butterfly needles, you have to you have to hold the butterfly wing and you pull it down. It will come inside as a safety. In some labs, they have some other mechanism. So different, we have varieties. Even in the lab, I am just seeing at one time I'm getting the button one. At one time we are getting the wing closing ones. So you should be knowing about these things. Miss, what to do if you go to the new site? Will the butterfly be the same as we use it in the college? We don't know. Follow the protocol, follow the guidelines. If you don't know, ask someone, get the training and start. Training not for a month, just one day you observe someone how they do and you do it and then it will come to you. It's nothing, it's no big deal. But there is one suggestion. When you read the Vacutainer, the butterfly needle manufacturer, BD, they say when the needle is inside the patient's arm, you have to press the black button. They have tried this. People in hospitals, some people are doing this, but keep this in mind, don't do that. Why? When you press the black button, there will be a strong jerk when it comes to the needle coming out of the skin, and the patient feels the intense pain. So what we do practically, we pull it out gently, press the button. And that pain is very severe, trust me. Clear, all of you? The tips, I'm giving it to you.
Clear.
When it comes to butterfly, 3 things. Stretch slightly, bring the tube down. When you're closing or when the procedure is done, the safety tip, according to the manufacturer, they say, keep the needle inside the patient's hand and press the button. That's very horrible pain. Pull this gently out and press the button. That's what we follow. Majority of them follow. Clear? Even I'm pretty sure Munmun also follows that. I asked her. She said yes, it's the pain is because she's in a hospital. I'm not in a hospital. She will have more experience when compared to these scenarios. Ask her the scenario-based questions to explain. She will do that. Clear?
Yes, ma'am. She had already demonstrated.
Yeah.
When
So,
she
so
used
many
the
situations.
butterfly.
It's not easy. Okay? Clear, all of you?
Clear, ma'am.
Yes,
clear.
ma'am.
Yes.
Clear.
So now, any questions? Or I can ask you questions based on this, because when you come from the break, we are going to start with the adaptive techniques. That's even more important. You have to deal with the paper that we left yesterday. We will be doing that. We'll be seeing other questions, everything. Okay. Now, based on this, let me ask questions. Okay. Okay. What is the best practice while collecting the neonatal screening card? I think we have done this. We have to put the blood in the full circle. Okay, let me ask. What is the best practice while collecting the neonatal screening card? Touch the punctured heel to the cord to allow the capillary action to fill the circle. Is it what we are doing?
No.
No.
We layer drops on until circle is full.
No.
Yes.
Maybe. Wait. Apply drops on both sides of the filter paper.
No.
No. Dry the cord horizontally at room temperature for a minimum of 3 hours.
Yes.
Good job. Okay. Okay. Now, which of the following is the characteristics of lancets used for capillary puncture? Reusable and can be cleaned in between the shift?
No.
In between the patients? I mean, no. They are non-sterile and they are very common to use?
No.
No. And it is disposable and used only once?
Yes.
Yes. And this is another general question. We have come across this. Sometimes they'll ask about the analyte. What do you think will be increased if the patient has hemolyzed blood?
The
Potassium.
Potassium will be high.
Phosphorus.
Okay, potassium will be high. And what will be increased when you do the collection using capillary puncture? I'm repeating this.
Glucose.
Glucose. Another option, potassium. Another option, HCT, because the blood flow will be slow, so the packed red cell volume will be increased. What will be decreased? Calcium will be decreased. Yes or no? The
Yes.
protein will be decreased.
Protein,
Okay.
yes.
Now, my question, what analyte will be falsely increased when a baby is crying?
WBC.
WBC. Good job. Who is this?
Mary's mom.
Okay. Good. Thank you. Now, syringe. What is the consideration when using a syringe to collect blood? We talked about this when there is a slide. Okay. What is the consideration when using a syringe to collect the blood? So you're using a syringe technique and you're collecting the blood. What will you prefer? Order of draw doesn't matter?
Food collection.
Yes? You said
It's a-
something, Maris?
Yeah, food collections, mom.
Syringe collection.
Yeah, the order of draw matters because you must not miss it. You must not miss the order of draw.
The question.
The order of draw is important?
Yes, it is.
Yes, very good.
Not when you're collecting with a syringe. It's important for when you're transferring.
Transferring. So
Yes.
look, yeah, I'm reading the question again. What is
Okay.
the consideration when using a syringe to collect the blood in? So this order of draw, it's not the right answer, right?
Okay.
Needle gauge sizes are different.
Yeah, the
Is it what you
Yeah.
consider when you just using the
Possible.
syringe? Okay, let me read the other options.
Yeah, read the other options.
Transfer after clotting as only used to collect serum?
No.
No. Will you transfer quickly to avoid clotting as there is no additive?
Yes.
Yes.
This could be
That's
the
something
possibility. So you have to connect the information, what is being questioned and what are the options given. So majority of us may be knowing the answer, but we have to apply it while choosing the answer. Clear? Now, when you are using the syringe method, why would a phlebotomist use a syringe to collect blood rather than the ETS? It can be to avoid the risk of additive reflux into the vein.
No.
Maybe, but let's see. It's used for fragile veins to be able to control the pressure.
That's the answer, ma'am.
That's the answer. Used when multiple tubes are required? Not necessarily. Used only when whole blood samples are required? Not necessarily, right? We use the lavender for the whole blood, green for the whole blood in case of PST. Now, what is the best way to avoid a patient fainting during a blood collection? Someone is collecting the blood and you want to know if the patient is going to faint or not. What will you do? You will ask someone to come and watch during the collection.
No.
As a technician, you should be there, right? You don't ask someone. Give them a candy to suck so they don't faint.
No.
No.
It's not that easy. You can take candy jar, okay, to make your job easy, but it doesn't happen that way. You ask them if they have ever had any complication during venipuncture or previous collections. A possibility,
Possible.
right? Have you done this
Yeah.
before? Have them sit with their back leaning to the wall and say, okay, position yourself and feel comfortable. Then you start drawing the blood.
No.
No, it's not that easy. So to my understanding, ask them, have you done this before?
Have you
Right?
Yes.
Yes or no?
Yes.
Yes.
Yes. Now, I think it's almost time for a break. Any questions so far? Because when you come from the break, we are going to go to a very big area of the venipuncture procedure. Yes, Azinath, you have a question?
Yes, Miss. I have a question. When you're collecting from a diabetic patient, what would you consider?
We will be seeing that in the adaptive technique. Most probably you have to look for the clots in the blood, the thrombosis.
Thrombosis.
Okay.
Okay, we will
Thanks.
talk about that. I'm going to explain that to you. No worries. So if you have something in your mind, we can talk about it. I'll bring some irrelevant questions based on the topic. So to make sure you understand the concept, what you are learning, because I made this revision because it's necessary for us. Sometimes we know the answer. I've seen majority of the students, even before the prior batches, that they know the answer, they are good, but they should know how to pick up the words and which one they have to focus and how they have to select the answers based on the questions. This is like a practice. For example, we talked about the consideration of a syringe, but so many things came to our mind. But the thing is, what we consider, that has to be picked correctly. Clear, all of you? Yes, Rujiatu, a question? Any question?
Are you hearing me? Are you getting me?
Yes. Yeah, I can hear you.
I'm trying to, the second to last question you answered, I did not understand it properly. The one, the phlebotomy misuse, why, when you as a phlebotomy use a syringe to collect blood. Yeah. What's the answer again?
Answers the fragile veins, collapsible veins. Look for these two options. Fragile, collapsible.
Okay, thank you.
Okay, look for these two options. Anyone will be given, so pick that answer. Clear, all of you? Any complaints? Any questions? Any complaints? Luis, Santiago.
All good, miss.
Some
All good.
people, they don't talk. I want to make them talk. Alexia, Amina speaks. Azina speaks. Chris, okay. Zarina Main, okay. Evelyn doesn't speak. I have to make her speak. Huda. Huda.
I'm speaking, ma'am. It's Evelyn here.
Huda, are you there? Joanna? Yes. I never said that.
We don't use varicose veins for blood collection.
Yeah, varicose veins is usually in the legs, usually because of the sclerosis or different situations. Where do you come across the varicose veins here? We never even use that word. Right? Yeah. Yes, just for 1 minute, quickly, I'll explain before taking the break. So the tubes, the colorful tubes that we use is for the normal veins, that where the veins are very clear and even they may be deep, but still they have a proper lumen, and where you can palpate them, you can feel them, and then you can insert the normal procedure with the needle, and then you just put the tube, you get the blood by the vacuum method. The vacuum has a pressure created inside the tube. Now this will make the blood to suck inside, but that type of pressure in a tube will be more. So if the veins are thick enough to collect the blood, this will be easy. But what if the veins are collapsible? They can shrink easily or they can just close easily. And sometimes the veins are so thin that this pressure is not enough to bring the blood. It will make the veins collapse or close the lumen. In that situation, this is the alternate method. So the pressure will be minimum and under control to draw the blood without closing. Is it clear? collapsing. Anyways, we are there to collect the blood. So this is a method when we see that the veins are very, very minute, delicate, and there's no way we're going to get the blood with a normal procedure, syringe method is used. Even in that procedure, if you feel the needle of the syringe is going to be a little bit hard for the patient, use the one that's more delicate, that's the winged infusion. We are going to talk about it when we come next week. I'm going to show the gauge of the needle for butterfly, syringe, everything. So that butterfly needle has a very good control when it goes inside the fragile vein. And with that, you can collect blood in the syringe attached barrel because there's no vacuum directly to pull it out. It's good enough to collect the blood. Clear? All these different methods are to get the blood from the patient, depending on the vein. You get this, Louis? Yes, yes, yes. Have a wonderful break. So any other question, please? I don't mind answering, but I want you to perform well in the test, have a clear concept of everything what you're learning with me, because this you're going to carry till your final exam and even after that in the workplace. Okay, have a wonderful break. See you at 11:35.
Sorry, Miss.
Thank you, ma'am.
Yes,
See
Yusra.
ya.
Yes, I just want to let you know that I'm not gonna be able to come after the break. I have an appointment at 12 o'clock. So unfortunately, I'm not gonna be here for the rest of the meeting.
Okay. So, okay, then good luck for tomorrow. You'll be there. So at what time we'll be starting? Okay, we'll talk about it. Have a nice break. Okay, Shreya, thank you for letting me know.
Okay, thank you. Thank you very much.
Ying Hong, okay, I'll take the attendance later. Okay, have a nice break. Thank you.
What time should we come back?
11:35.
Okay, thank you, Miss.
Miss? Miss?
Hello, welcome back.
Thank you, ma'am.
So we are going to see the next techniques, adaptive techniques for phlebotomy, which is considered the most important part when performing the venipuncture. Before that, let me have a quick look who's here, who's not here. Let me start with Alexia. Welcome back. Alexia, are you there? Hello. Amina? Yes. Arsinet, can you hear me?
Yes, miss.
Yes, ma'am.
Yes.
And Christiana? Chris? Sarina Main? Eveline? Hoda? Hoda, are you there? Can you hear me? Alexia, are you there? I want the whole class participations, not like few people talking, few people not. I will consider that as absent. Yeah, yeah. Thank you. So I'm not hearing Huda. Alexia. Joanna, are you there?
Yes, ma'am, I'm here.
Okay, good. Kara, are you there?
I'm here.
Yes. Louis, yeah, good. You responded. Maris, I
Yes,
can see
ma'am.
Maris. Yes. Rujiatu, are you there?
I'm here. Can you hear me?
Okay. Yes. Santiago.
Hi, Miss.
Hi. Shabana. Shabana, can you hear me? I'm missing Shabana's voice. Okay, Verna.
Here, ma'am.
Ying Hong.
I'm here, ma'am.
Yes, good. Seneda.
Here, ma'am.
Yes. So Yusra. Yeah, Yusra told she'll be with the appointment. So any questions so far? Everything good? With the previous chapters, I mean, previous topics.
I think so.
Yes,
Yes,
good.
ma'am.
So the point is, if you have any question, it may be silly or it may be like some other thing that might have been repeated in the class, don't hesitate to ask. It's a way of understanding and learning. Okay, you can ask at any time. I can explain it to you. So we'll start without wasting our time. Alexia, are you there just once again? I can see her name, but she's not responding. Can you hear me, Alexia? Hello? Okay, Huda. Huda. You guys can hear me, all of you?
Yes.
Yes,
Yes,
ma'am.
we
We can
can
hear
hear
you.
Yes.
Yes, miss.
Okay. Shabana has to come. I think they're taking relaxed break. Good. Okay, quickly, let's move on to the adaptive techniques. We all know what does adapting means? Adaptive techniques means something that we have to change or modify based on the circumstances. right? Based on the situation of the patient mainly here. So what are the things that we can adapt? We're going to see. We already talked about this, but still a little bit more specific about how you may get, how you might be questioned or how you may get questions, the different options. Once again, the resource will be Phlebotomy Essentials. Book, the chapter has been given, the pages have been given here. You're going to learn the different techniques because not all patients are the same. There are a lot more things that has to be explained here when it comes to the exam point of view, or mainly tomorrow's test. Let us keep the exam later because I'll be revising more with you with different activities, even with the videos when you come even next week to the lab. But from tomorrow's perspective, I'm just bringing these questions and options. So how you have to pick, what you have to look for. So whatever you have learned, even though if you know the answer, sometimes it happens that the students, they're not able to pick the right answer because of the understanding of the words. They're not getting it in a proper way. So this is my point of revising again, because to make you understand while reading the questions, read carefully, pay attention to the words that has been they are looking for, that's been pressurized, even the mainly the words that been coined actually, and the options given in the answers, how to pick, how to read and pick. This is like a training and this is a revision I'm giving it to you. So even if you know the content, majority of them, I'm pretty sure they know the answers, but how you answer matters, right? How you pick matters. That's the reason why I have to revise this again and again and making you and insist you to read the question word by word and pick the answers. Okay. Now, every collection is not going to be identical because every patient is not the same. We know that we have to adapt according to the child, according to the old people, according to some challenges. The main challenges will be mobility, hearing, sight, some other illness, Parkinson's, for example, how you use the procedure to collect the blood. Burn patient, this is another option, and cancer patients because their immune system will be low. You can find mainly for the cancer patients, the veins will be sclerosed or calloused because of the repetitive drawing of the blood. Maybe they will be ending up in iatrogenic anemia. So what we have to do, we have to see the patient's history. Based on that, we have to see the requisition and we have to pick the correct procedure. It could be a syringe, it could be a capillary, okay, if not venipuncture. That's why we are studying it in detail. And approach the patient will calm, and this we know how to show the professionalism. We are okay with it, and make sure if there is something, illness or some other situation, a nurse should be there, a family member should be there. But if you are doing the procedure with them, what you have to do? Am I talking too fast?
Sorry, Miss.
No, but like, who are you
Repeat.
be a little
Yeah.
more specific? Like, what
Yeah.
patient would we be handling?
How, okay, you are going to do the venipuncture on a patient who's accompanied with a nurse or some other caregiver. What will you do? In terms of venipuncture, you will be doing the venipuncture. Yes, very good.
Yes.
At the end, what you have to do. This is my point.
Okay, so if the person is accompanied by somebody, that usually signifies that they are maybe there's a cognitive disability, a hearing.
Some other illness. Okay.
Yes.
What will you do?
Then you would actually ask the provider, the caregiver, the nurse to identify the patient and to complete your
Echoing
phlebotomy.
because, okay. And after doing that, the main thing I told you, document it. Document it. Documentation.
Where
is
do we
part of-
document this?
In
On
the
the
requisition. In the requisition, at the bottom, there'll be a
Okay.
space. You have to write
For
it.
notes.
Yes.
Okay.
Okay. Good. So this is considered an important part of documentation, is an important part of our job. You log the checklist log document for requisition, document if there is anything. If the patient refuses, document. If the blood flow is stopped in the middle and then you're going to do the capillary, document. So everything you're going to document. That's a job. Okay. And pediatric collections, we have talked about it. Depending on the age, you have to ask the parent about the child's past experiences and everything. But I have a question related to that. What will you do? Will you ask the parents to hold the hand of a child in case of venipuncture as a phlebotomist? Do you agree with this? True or false?
I've had to do it.
Parents are allowed to help hold their children steady
Yes.
during blood collections. True or
Yes.
false?
Yeah, true.
Yes.
True.
True.
True. You have to agree, right? Okay, some parents may be annoying, so tell them to stay outside. Better, right? Because it will increase the anxiety. How will you reduce the child's anxiety? Involve them with, if they ask questions, answer them calmly, peacefully. Don't tell them, don't give them false hope or false statements. No, it won't hurt. No, it's not our job. Yes, it will hurt a little bit. You will overcome this. You will come out of it. It is for a short time. And give them the confidence that you are there to take care by putting the positive words. Okay? And also involve them if they are a little bit okay, if they are of 7, 8 years old, so you can involve them. Can you hold this? Okay, can you keep the band-aid in hand? Look what this is. So all these things you can do. And if some children you think they are like with ADHD, they can't sit. It's very tough. Give them the numbness injection and then make them they don't feel the pain. This is the last option. There's a cream that you have to apply and say okay, and tell the parents to hold them and then do the job, because you know when they're going to jump, when they're going to do what they're going to do, so it's risky. Okay. And assess the anxiety levels. So to avoid the anxiety of the patient when it comes to children, you sit at their level and you talk at their level. Are you interested in doing this? Do you like painting? Do you know like do you go to music classes? Which music you like? If they say yes, I like pianos, I like, so bring that conversation and sit them, because if you sit there instead of bending or standing, they will feel the closeness, they will feel the belongingness, and then they will be okay with it even if the parents are there. So understand what they need and then do accordingly, okay, to avoid the anxiety. Because if the anxiety is there, the chemical imbalance will be there, even the test results will be won't be accurate, it will be inaccurate test results. So we have to consider everything. How to best handle pediatric patients is one thing. Never lie, I told you. Okay, it may hurt just a little bit, but it'll be over. That's it. And now give the child a job. I told you what you have to do. If they like the adapter, give an adapter. We have so many liver adapters. They say, wow, it's a beautiful color. Give them one in their hand. Okay, observe this. Let them admire. You do their job. Our job is to collect the blood. That's it. I won't mind even if the child is interested in taking the adapter home, but I want to do the blood collection properly. I will be focusing on that. Okay. And counting, singing, games, movies, videos, we talk about it. And validate the feelings, like offer a reward like for being brave. Like for example, if they have done the job perfectly, if you have something to give a candy, a chocolate. If what if the child is diabetic? So nowadays this is also a concern. So better have stickers or something like a pen, a crayon set, something like that, whatever you can, just to make them happy as a reward. But don't tell them like, if you do this, I will give this. That they don't like. So avoid all those things. Now, if it's a crying patient, somehow or anyhow, we have to come to a conclusion of calming them down without crying. Why? We answered the question before. Why? What if the crying babe, child is there, you're drawing blood, and that too, you're taking a lavender tube, whole blood? What happens?
The WBC increase.
WBC will be increased. So the doctor will think, okay, this child has more WBC. So we have to do something about it. Maybe the immune condition is there or inflammation is there in the body. These are the other options the physician will be thinking about. And sometimes I would suggest if the patient has cried a lot, now more often the child is crying, and at one point you have drawn the blood, document it. This child was crying a lot. They will understand. If their WBC is going up, then they will understand. Okay, this is not the problem with this metabolism. It is a problem, emotional problem that has caused the WBCs to go a little bit up. But as a technician, make sure that the patient shouldn't, I mean, the child shouldn't cry, because it will be annoying for us also. Annoying in the sense, for us, it's like a distraction. We have to somehow make them like calm, right? Give them some time. It's okay. Give them some time. And look at this. They have put it in parenthesis, which means is you have to focus on this WBC. It's important. Okay. Okay, now we all know a parent should be there. It's okay to be a parent over there. They have to hold the hand also. And iatrogenic anemia, what is this? Loss of blood due to multiple collections. So sometimes you will get the term what does iatrogenic anemia means. Iatrogenic anemia means it's a condition where more blood collections have been done. Where will you come across the iatrogenic anemic patients? Usually it's not the outpatients, it will be the inpatients where child has been admitted, for example, in the sick kids hospital for a week, 7 days. Daily, some amount of blood has to be collected for some diagnostic purposes. So repeatedly the blood will be drawn. So you have to know what it is. Okay, and mainly for the neonates, the newborn babies, when they are born, when they have illnesses or disorders, it's very, very hard for them even, right? They cannot communicate. The only communication you'll be seeing there is crying. So in this case, the heel puncture or the capillary puncture is the one that we usually go for, because to avoid the cardiac shock. I told you, venipuncture cannot be done on these because the veins will be delicate. And even sometimes the capillary puncture is not advisable because it's again and again this will be bruised, and it's not the fingers are more delicate when compared to the heel, so heel puncture is a better option. So you should know about these things. So most concerns, or even this is a concern for the geriatric patients, as they say, sometimes you may be getting a question. Iatrogenic anemia is an issue in what type of patients? Pediatric and geriatric, only pediatric, only geriatric, weak patients, cancer patients. You should be able to answer old patients and pediatric patients. Depending on how you get the question, you have to pick the answer. Okay, so for the neonatal collection, there'll be a collection log, how much amount of blood you have to draw. The volume should be written. As I told you, why? What's the reason? Because there is a limit. You cannot cross the limit. For example, per day you can collect only 2 ml, so you cannot exceed like 4 ml daily, because I told you that body cannot take this stress. It leads to cardiac arrest in babies because of the shock of the body. It's important. Clear? Any questions related to the pediatric patient?
No.
No? So you will answer the questions, because when I'm going to question you, you should be ready to answer, right? Okay, now what about the welcome back, Shabana? So this one, the geriatric patients. Is Huda there? Huda, can you talk?
Yes.
Okay, good. Welcome back. Alexia, can you talk? I want to hear your voice. Voice. Okay. Now, no questions. So we are moving towards the geriatric patients, because we can discuss at the end some of the important points that we have to look for tomorrow's test. To feel comfortable working with the aging, understand the aging process, you will come across the aged people, but there are different things that you have to focus on. It's not only pertaining to the puncture. The nature of collection that you're going to use, it can be capillary, can be syringe, mostly because they have a collapsible vein, sclerosed vein. Okay? And sometimes the veins look prominent, but you won't get the blood. That because the lumen of the vein will be very narrow, or sometimes it's completely closed. So in that case, you have to pick the capillary puncture. Or if the veins are more like fragile, more tender, so go for the syringe. So you have to know. You have to understand their psychological condition, and you have to collect the blood. You have to show more kindness, more patience, respect, because they get frustrated easily if they feel they no respect. Okay. And what in case you have to do in case of collecting blood from the geriatric collections? Based on this slide, you will get a question. How you communicate with an aged person while doing the venipuncture? A, speak clearly and slowly. B, talk to them loudly. C. So all these options will be there. So based on this slide, you pick the statement that's here. So go through this information, okay? And physical changes. What are the physical changes that you can experience in an aged person? A, skin changes, any diseases, mobility issues, mental and emotional conditions. So one of the answer will be here along with the other statements. So pick the answer that is more relevant to that question. Clear?
Yes, miss.
Yes.
Okay.
Yes,
What
thank
if they have some other problems? We talked about the acuity problem, ACUITY. Acuity problem is like hearing problem, seeing problem, the vision and everything, right? So there can be those type of things. Now look at the skin changes. Loss of collagen and fat results in sagging and wrinkled thin skin. What makes the skin of an old person less elastic? A, loss of collagen and fat.
Collagen, yeah.
Okay, so this you should know how to pick and how to answer. And lower blood flow. Okay, staying high. Next, veins can feel sclerosed, harden in case of the example. An old patient is coming for a blood collection, and you feel that the veins are sclerosed. Now, what type of puncture you'll be doing on that patient? That might be a question like this. Option, syringe method, butterfly method, capillary method. So you have to go for the right ones. Okay. Okay, veins are more fragile and have more tendency to collapse. So you pick according to the question. So look at this one. Smaller fragile veins can collapse due to the vacuum pressure exerted from the evacuated tube system. This is the one clue that you have to focus when it comes to the fragile veins. What is happening when we are using the regular tubes? It's collapsing due to what? Because of the vacuum pressure exerted. The suction pulls the sides of the veins together and blocks the blood. So the suction will pull the veins and it blocks like this. So blood won't flow. So in this, you will insert the butterfly depending on the vein condition, right? Use a syringe to collect. Pull the plunger back slowly to control the pressure. This slide gives the information about what is happening when the veins are fragile. Louis, do you get this? You were just questioning about this before, right? Okay. Yes. Yeah. So the tourniquet may have to be left on during the collection to keep vein distended. Another important point, you may get a question. Why the tourniquet in old patients should be left on during the collection? Option A, to keep the vein distended, which means they have to have that flow based on the pressure. They need that. For the other ETS, if you see the blood, you can, after two, if there are multiple tubes, close to the end, you just open the tourniquet or release the tourniquet. Some people, they release the tourniquet based on your experience. They release the tourniquet when they see the blood. That is also okay. But what happens if they have to collect 5 tubes, the blood will stop after the 3rd tube. That's why I always suggest leave it for a while. Look at the tubes, look at the requisition, check for the tubes. If there are 5 tubes, go up to 4th tube and release when half full. That's the procedure. That's what we do. Okay? But if you are becoming an expert, you can just insert the tube and pull it quickly. Then you can use the first tube release of tourniquet. But that comes with multiple venipunctures. If you become more experienced, you can do that. Otherwise, when you have to take 5 tubes, go for 4.5. Then you release slowly. Till that you can get the 5th tube as well. Okay? Now, diseases, disorders, Alzheimer's, arthritis, coagulation issues, and again, diabetes. Now, people ask the question, I think Eveline asked, diabetes affects circulation in lower extremities, which means on the fingers and the toes, may have to warm the site to improve blood flow to area. So we are not going to use the foot for the heel, mainly to get the blood. So no worries. So affects circulation in lower extremities, may have to warm the site to improve the blood flow to that area. Leg, foot, ankle collections are off limits, risk of thrombosis. Clear?
Yes.
Okay. Now, Parkinson's disease or stroke can affect the patient's speech. Tremors and movement of hands can make it hard to hold still. So what will you do? What is the procedure as a technician you're going to use? What happened?
Ask
Tell me
somebody, ma'am,
something.
to assist you.
Yes?
Ask somebody to help you because
To
of
help.
the
Okay, that's
trembling.
one possibility. Okay.
Yeah.
But
Use the
still,
butterfly.
they're not getting the blood. What will you do?
Capillary.
Capillary puncture. Because ask the doctor.
Yeah.
Ask the doctor, what is the priority test that they want? Like they say, I want to see only the glucose in the blood. Which tube will you take? They want to see immediately the glucose.
Gray.
Yes.
Green. Green, PST glucose, instant, stat. You get my point? A patient is coming. And then I know for normal procedure, we use gray. And that too, nowadays, gray has been like stopped in majority of the labs. PST, glucose instant, stat green. Mainly when they come for the hospital situations, this is what they do. Okay.
Oh, what about in a regular lab? Would that then be yellow, like a gold one, SST?
Yeah, if it's a life lab, if the life lab has ordered, like if you are working in a life lab, for example, it depends on the lab protocol. This is what I mean to say. If you are in the life lab, I'm in the life lab, I'm seeing the requisition with already 12 tests for electrolytes. It means where will the tube go?
Chemistry.
Chemistry. What tube should I pick?
Yellow, SST.
In the same yellow, they have the analyzer to test the glucose.
Okay.
Nowadays, the analyzers are doing the job. Okay. Now, in some labs, they use the green tube. Maybe the Dynacare, I think they're using the green tube. The hospitals use the green tube. Clear?
Yes.
Yes, ma'am.
We talked about the gray tube, why they are stopping after 2021 because of the cost, because more amount of blood volume should be there, because the anticoagulant has to be mixed in order to get to test the glucose level. And why it's expensive, because we are using 2 chemicals inside. One is to prevent the glycolysis, the other as a preservative. If the ratio is not appropriate and if it's not mixed properly, the results go up and down. That's why the invention of the point of care testing is handy. The point of care testing is a breakthrough to check the glucose. You can do that instantly. You can see the monitor. The only thing is check the batteries. That's it. The inventions and the testings are depending now on the machines, on the analyzers. It's not the old methods that we follow, waiting for taking more time to check the patient. Why this has been happened? Because a patient with more sugar ends up in some other problem. A patient with less sugar ends in a coma because the only food that the brain is consuming is glucose. If enough sugar is not going to the brain and if the transmission of messages is not there properly, if the energy to the brain is not sufficient, brain death, coma. Clear? That's why this POCT testing is handy and it's really, really a good choice. You don't know, some people with diabetes, they are under high risk. That's why, according to the PEAL, Public Health, you have to report a cancer patient, a diabetic patient within 24 hours to the physician. You are the technician, you know that this patient is, like the doctors mainly, they should know about the patient. Whoever is doing the diagnosis, they have to send the message immediately because the treatment has to be done. The help has to be done to save these patients, just to let you know. For the PEAL health, the communicable diseases, the doctors, the physicians, they should know when it's a cancer or diabetic patient. Critical. Clear?
Yes, ma'am, clear.
All of you clear?
Yes, ma'am.
Yes. You should know as a technician. Next, mobility issues. We know wheelchairs, it has to be locked and accommodations should be given to them. They have to keep the wheelchair under non-slippery, in a non-slippery mat. You have to check the locks and then you have to tell them that the procedure. What if you don't do that? If the wheelchair moves, the patient may just move and then they can fall. They're very, old people when they come, they're very delicate. They don't know, sometimes they don't even have the control for petty little things. It's very hard for them. And they are in pain and they are with some sort of disease. And the main thing is like the confidence that they should have, they don't have because they are depending on someone else. That's why they are frustrated. We have to see their emotional situation, psychological situation, their physical situation. Okay, some are very cooperative. Majority of the old people, they don't cooperate. Never mind children. They are very dominant. Sometimes they are very harsh. Sometimes they are very rude. Sometimes they throw things. So you have to be you as a professional have to be calm. So this topics, the whole adaptive chapter is very important because based on that, they have given the information what as a technician you have to follow. All the information, I believe, whatever we have learned so far is really important when it comes to the venipuncture, right? Yes. Help them, assist them, reduce their anxiety. Old people like talking. Old people like talking because no one is there to listen. Everyone is busy in their life. So if you talk to them, they're very happy. Okay. Now, there may be a nervous condition where they cannot. That's the Parkinson's and slower learning because their system will become slow, lack of energy. And sometimes if you say something after 10 minutes, they get the information. I have seen this because I volunteered in the adult center. I volunteered. When I observe some of them, I come home and I cry. That was a situation. I saw one patient with Parkinson's. She cannot sit, period. For her, the eating time is very hard. She feels hungry, but she cannot sit. Her body is completely all the time shaking. And what we do when we volunteer, we have to walk with them to feed them. I did that. I volunteered. Again, I'm putting this volunteered. I have seen so many situations, and we have to make them active also, because um, afternoon after the when they just take their food, they will have a nap. That's a different story. Before that, to keep them awake, because they are not supposed to sleep during their lunchtime. It's very rare that some people they sleep and then they cannot control their sleep, so they will sleep. So they will tell us, you monitor them, because they have to eat on time, because the medications has to be given. So in this situation, we have to talk to some old patients, and then we have to keep them awake to eat. And I found one old woman, she will just completely throw whatever she's having in the hand when I tell her not to sleep. I have to be very careful, and nothing should be around. Okay, so these are all the situations. And one lady used to tell all the time, I don't have my children close to me. The children are now big adults, 50-year-old, running to just do their job, to help their families. They don't have time to sit and talk to them. So these are all the emotional situations. Why I'm telling this in detail? Because I have experienced, I have seen, I know how they feel. Sometimes when you hear their stories, you will cry. They have worked hard for the family to raise 6 children, and now they feel at least one child should take care of them. And in the evening, when they go home and someone is there to pick, they shout like a baby. Sometimes when they like the volunteers, they will tell us, can you come home with us? So I have observed these situations because they need that. So be compassionate, right? So show some empathy. I would say complete empathy towards them, because they need that. They are human beings. We will cross that age. We don't know how we are going to behave. Okay, so be nice to them. As a technician, it's our job. Yes, we can't talk for hours. We have things to do, but yes, we have to be compassionate. We have to show patience. Okay, so all these things. So any questions? And physical challenges, we talked about it. Acuity. What does acuity means? A problem with seeing, hearing, understanding, right? And you should know. Now, there will be a question. What are the problems associated with acuity? It's the seeing, hearing, understanding. Okay, pick the answer accordingly. Now, hearing impairment. I have a question for you. Okay. Oh, God. Hearing impairment. Which of the following adaptive technique is used with a patient who is hearing impaired? Look at the question. For the hearing impaired, for the impaired vision, you will be getting a question. Which of the following adaptive technique is used with the patient who is hearing impaired? A, narrate the procedure. Are you going to narrate the procedure to them? Or shout loudly? Or
No.
ask for an interpreter?
No.
What
No.
the interpreter has to do, it's not a language issue, right? It makes sense to you. Speak clearly facing the patient.
The number 4.
Number 4. So this is how you have to pick. So of course they have some issues with hearing. So they may have trouble distinguishing the sounds. That's why you have to look at their face. So with the lip movement, they can grasp. Okay? Clear, that's why you have to face them and speak them clearly. See, this is the option you have to pick. Never shout. They say never shout. It doesn't matter. Even if you shout, they're not going to get it. They will see you as a frustrated person. That's it. and it will increase their anxiety. You won't get the blood. What to do? Watch for nonverbal cues. Okay, indicate the patient like what they have to do, and because they can see clearly, you can use the pen and a paper. You may get a question, what is the other option of explaining a hearing impaired patient? Speak loudly, and then narrate the situation, bring an interpreter. So whatever it is, then you have to pick for write down in a pen and a paper. This is how the options you have to select if it's been asked. And what are the things that you have to avoid? Asking patients to confirm the name only, get them to state and spell their first and last name, not the whole history, date of birth, are you fasting? We don't ask with this patients because it will increase their anxiety because they have a problem hearing. Okay. If they can hear only partially, okay, then what you'll do? They cannot hear you fully. They can hear partially. What will you do?
Still, we have to face the patient.
Still, we
ma'am,
have to face the patient, and then you have to convince them. Take your own time.
Exactly.
Okay, but don't turn
Slowly.
at the back and then talk. Nothing is going to be like entering in their mind. So they cannot take the information. It's not their fault. It's not their fault. Okay, don't turn your back. Don't turn your back at the patient. If you are wearing a mask, miss, what to do? It's a COVID time. You're wearing a mask. Lower a little bit down. This is how you have to do. You have no choice because that patient, that's the best choice. Pen and a paper. Clear?
Yes, ma'am.
Now,
clear.
visual impairment. You will get a question in this. What is visual impairment? We all know. Okay, then it can be light sensitive, legally blind, poor vision, everything. How will you help the patient? How are you going to do?
Provide adequate lighting with no glare.
Yes. Then, if they cannot see properly in a dim light, then you have to open the light. If they feel that lighting is bothering them, you have to diminish the light. Okay. Then this is for the urine collection they are talking about. Never mind. Now here you have to narrate. Here, because they can hear you. The problem is the vision. So here you have to narrate, not with the hearing problem patient. The hearing problem patient, you have to speak clearly, calmly, facing them. Okay? If they can see clearly, pen and a paper. But here, no pen and a paper. You have to narrate the situation because they can hear clearly, but the problem is vision, if that is the situation. Pick your answers according to the question that's been asked. And don't use gestures when it comes to the vision problem. And don't raise your voice because they can hear you. You don't have to. Okay? When you're narrating the procedure, calmly, slowly, that will increase their confidence on you. Clear? Why we have to do all these things? You have to do all these things because if the anxiety level increases, the blood draw is going to be difficult. Even if you get the blood, the test results is going to be inaccurate. Clear?
Clear.
All of you?
Clear, yes.
Clear.
So I'll deal
Thank
with the
you.
cognitive, then I'll come to you.
Ma'am?
Okay. Yes.
With vision impaired patients, so you tell it we just have to narrate the procedure, right?
Narrate them slowly,
We don't
calmly.
have to
Don't
speak.
scream at them because they
Okay.
can hear you. Right?
All right. All right.
Okay. They can understand the concept clearly, but you don't write it on a paper and show it to them. Why?
Because they can't see.
Yes. It's like a vision issue, right? So now I have a question to you. We talked about the hearing impaired. Okay, I'm going to talk about the visually impaired. What is it? Okay, which of the following adaptive technique or collection technique can be used with a patient who is visually impaired? Option A, write down the questions.
No.
No.
Ask for an interpreter.
No.
No.
Speak louder and slower.
No.
No.
Narrate the procedure.
Yes.
Number
Yes.
4.
Based on the slide, yes, this is how you have to be, you have to pick the answers. Got it?
Okay, thank you.
Yeah, most welcome. Cognitive issues. We all know cognitive issues that has something to do with the understanding or the perception of the information, processing and retrieving. So this has to do with the intellectual ability. Some people are slow. Why? Question. When older patients are coming, majority of them will be slow. Why? Because the message going to the brain and the processing of the information, and again the message coming to them to react will be slowed. What if a young gentleman is entering inside the lab and then you are frustrated because he's coming slow, walking slow, even when you talk, he's getting the information slow. Will you be frustrated? Professionalism, what you have to do.
You help them.
Help them. Stay calm. It's okay. Now you will understand. As our cognitive abilities are good, we are blessed. A big salute. We are there to help others. This attitude should come in your mind. The immediate reaction, help them. How will you help? Take your own time. That's okay. No rush. If you rush, that person will go in anxiety. Anxiety issues happen when someone is not able to cope up with the situation. Don't give them to be anxious. Help them to bear with the situation, deal with the situation, so your job will be easy, the test results will be accurate. Clear? So in this situation, give them the time. Explain it to them. If they ask you more than 2-3 times, that's okay. It's no big deal. Communicate in a way where they feel comfortable. Okay? You have to take care of this. What are the situations that can be a cognitive issues? Brain development, dementia. When it comes to the old people, dementia, forgetfulness, they will tell the name and then they will forget. And you will be introducing, this is the one example, you will be introducing yourself as a technician, standing there telling name 4 or 5 times. And for the 6th time, they will ask you, who are you? That's okay. When they come with, usually people with dementia, they won't come alone. There'll be a caregiver. So let them take care of that. You don't have to be frustrated. You don't have to worry. You do your job. Alzheimer, Parkinson, dementia, strokes, brain injuries, Down syndrome, more disorders of the brain, depression. People with anxiety disorders, don't expect the collection is going to be the same. It's challenging. And clear about the cognitive? Okay, now, the areas to be avoided, we all know burns, scars, tattoos, because to avoid infection. Now, a question will be there for you. For example, we have to avoid the tattooed area. Why? In majority of the case, like we try to avoid, if nowadays people are coming with tattoos, you no choice than palpate and do the job. But why we are concerned about the tattooed areas?
Infection.
When it's new, yes, newly burned,
prone to
newly tattooed,
infection.
yes, very good. Are prone to infection. So you will be getting a question like this. Okay. Damaged veins, we cannot, because what do you understand by damaged veins? It can be no elasticity. Okay, they cannot bounce. Or multiple venipunctures has been done, so they become thickened, sclerosed. Drug use patients, they inject the needle at the same spot, so that may happen. The blood flow won't be that good if you do the collection. Sometimes you won't get the blood in sclerosed veins and calloused veins done. And edema, why we can't poke in the edema? So you will get a question based on this. Are we allowed to draw the blood if a patient is having a condition of edema?
No.
Oh.
No. Why?
Too
Why?
much fluid.
Testing.
Swelling caused
Sharing
by
this
accumulation
result.
of fluid, accumulation of
Yeah.
fluid in the tissues. And the test results won't be accurate. And hematoma, swelling. I told you, this is a situation we face in some students, even in the lab. So this is a minute dot of hematoma, but that's okay. But when you get a condition like this, some students, they feel it's good to see the point. They want to go in the same point. Don't do that. Check the area below that. Because what will happen if you draw blood from a hematoma? Question.
Hemolysis.
Hemolysis, sometimes the clot will travel. So results will be inaccurate. And
Yes.
also this condition may result to more bruise, painful, right? And now, see one example. And now we know what a hematoma is. We don't do, okay, now if the hematoma is after the collection, you have to put the pressure, right? Can bleed out of the puncture wound on the skin. So make sure you have to put the proper cotton, proper procedure, keep ice, best thing to do. Bring the ice pack, don't keep it directly. You just wrap it with a cloth or a paper towel and keep it on the hematoma area. The best thing to do. Okay? So here, note these points. Pool blood within the arm, so that can migrate even to other areas or can cause compression injuries to nerves. So this is the main thing. What can hematoma do? Hematoma can cause compression injuries to nerves. Know this point. Avoid these areas, mastectomy. We talked about it yesterday, what we have to do, right? What will you do if it's a patient with mastectomy? Azinet, you told the explanation yesterday. I want someone to explain this to me.
You use the opposite side, and if there's been a double mastectomy, you'd have to ask the doctor because only a foot puncture can be done within a doctor's approval.
Yes. Okay, so this one. So consult with your physician, the best thing. Next. And you document it. Other challenging sites, obese patients, not easy. For most of the obese patients, I suggest tie the tourniquet a little bit tighter and then tell them to open and close the hand. The vein will pop up a little bit and then you can feel it. If you cannot do that, for some, the veins will be deep, so go with the butterfly puncture. I have found butterfly is really, really good in this case. If they are really, really obese, then capillary puncture, ask the doctor, which is the test that's in priority, and then take the blood. Okay? And next, I told you about the double tourniquet. That also helps. And what if the patient has a paralysis? Thrombosis can happen, traveling of the blood clot, right? So can affect blood flow, increased chance of thrombosis. So it's no good, no safe. So follow the guidelines. So for these collections, when you're hired as a lab technician, mainly as a phlebotomist, there will be guidelines as standard operating procedures, or there is a blue book which we call CLSI guidelines. It will be there. Go to that particular topic, follow the index, take the page, read the information. And if you want to double check with your colleagues, do that, or you can ask your supervisor, they will guide you. No worries. Clear?
Yes.
Yes, clear,
No,
ma'am.
this syncope question, a syncope question will be there in your, anyways, 1 or 2 questions will be there based on the fainting. This fainting is very important, the topic. Okay. Now, medical term described to use fainting.
Syncope.
Syncope, we all know. Now look at my question. I mean, not looking, you hear my question. What is not a physical indication a patient may begin to feel fainting? You're looking at the patient, you're drawing the blood, you're seeing them, looking at their face. Now, what is not a physical? Physical means the overall appearance. It is not an indication that this patient is going to faint. What are those things? Hyperventilation, one option. No.
No.
Hyperventilation, you can see physically the breathing difficulties, right? Dizziness in the sense the head going like this. So that is a physical indication.
Yeah.
Muscle twitching.
Yes.
Yes.
Not muscle twitching.
Is not a physical indication for fainting. Am I right?
Yes.
Okay,
Yes.
so you have to pick the answer. Okay. So what is the medical term used to describe an abnormal accumulation of fluid in the tissues?
Edema.
Edema. You should know this. Okay. Now. Second. Okay, what is not a technique? As a phlebotomist, you're performing the venipuncture. Now, something is not acceptable as a proper phlebotomist, mainly for the pediatric patients. Okay? But anyhow, you have to collect the blood. But something that you're telling is not appropriate when it comes to children. What are they? Get on their level and approach slowly. That is possible. Encourage their involvement in the process. Yes, they can do. Yes or no?
Yes.
Yes.
And distract the patient by singing a song, rhyming some other talk. It is possible.
Yes.
It's possible, right?
Yes,
Which is
ma'am.
not accepted as a phlebotomist. Telling them it will not hurt.
Yes.
Yes.
What do you think? Yes.
Yes.
As a
Tell them
professional,
it will not
we
hurt.
have seen this in so many situations. Don't lie. What will happen? Why we cannot lie? Because it's not professional. It's unethical. And mainly, you have to collect the blood from that child. And the child will become anxious. The test results will be inaccurate. Moreover, emotionally, the child is not going to trust again any medical professional at all. For them, the recorded messages, these people are going to lie. For them, the message that is recording is, okay, you know what? These people, they say that, but on that day it was very hurtful. It was hurting me a lot. But that lady said it won't hurt. I don't like that. And they will record in their mind. And repeatedly, whenever there is a situation where they have to go to a doctor, a physician for any purpose, they will refuse. A challenge for the parents. As a parent, I don't want my child every time screaming and struggling to go for a checkup or some other thing. As a parent, will you agree with this? You won't like it either. You have so many things to do. It's an extra job, right? This is one condition that we have to look for. Clear? Next. What are the reasons for fainting? Stress, because they see the blood, okay? Dehydration, anemia, emotional stress, hypoglycemia. Again, there will be a question. The syncope can happen because of hypoglycemia, hyperglycemia, all those things that's been listed. If you see something which has been listed here, go for that. Okay, because the syncope is very important topic. I told you, even after completion of the course, when you come, I have to talk about it. So at that time, I'll make you talk. I'm not going to talk. And now, ask the patient before any complications have they done before. We all know this again and again and again. We are repeating. Clear? Monitor them. What if the patients, you're doing the venipuncture and the patient is telling you, I feel dizzy? What will you do?
Stop.
Stop the collection.
Continue.
Safety first. So first tourniquet quickly, remove the needle. Okay, don't now look for the procedure of taking the tube out and then taking the needle out. Just pull it out. The next step, tell them to put their head down on their knees. Give them the pillow. Keep the pillow on the lap and tell them, can you please bend your head and put the head on your lap? They have to do. You have to support them. Why can't they go like this? Because the blood has to go. So it should be a little bit down. What if the patient is lying down on the bed, if it's telling like, I feel dizzy? You don't have to worry about the falling or the safety. How will you do? Will you elevate the head or will you bring the position down? Head down, little bit down, because there are reasons why we do this. Okay? And let the patient remain in area for, now this number is very important. Yes, Hingong, go ahead.
Sorry, Miss, what is the cold compress?
That you apply on the neck after.
Okay, thank you.
Because, yeah, for the nerves to calm down or to bring it to original position. So that's a different story. But when you're doing the blood work, do this immediately. Then put a cold compress or ice pack here on the neck. This is what they recommend. Okay? And now, look at this number, 15 minutes. Record this in your mind. Based on this, you will get a question. For how many minutes the patient who is feeling dizzy has to be monitored?
30 minutes after collection.
Let patient remain in area for
15
minutes.
15 minutes. 15 minutes. Okay? You look at the numbers. 15, 20, 30, because here it says 15, pick 15. They shouldn't be driving for how many minutes?
30
minutes.
30 minutes.
30 minutes. And what you have to do in case if you do this procedure?
Document.
Document it. I told you with explanation the reasons behind it, right? Can you recall that?
Yes.
Yes, that's the reason. For future litigation, this is very important. We don't want to stand in front of the judge explaining in spite of doing the venipuncture. So keep your position safe all the time. MSS, we talked about it, right? Yes or no? Do not attempt a blood collection on a patient who is feeling nauseous, vomiting. What is emesis?
Vomiting.
It's a technical term you will get in the question. What is vomiting? Emesis, edema, all those things will be listed. Okay? Give them the basket or whatever they feel like throwing up. So please help them. Pain. Okay. Usually the venipuncture should be a pricking pain and that's it. You have to stop. What if the patient is telling, oh, I can't bear it? It means what has happened? You poked a nerve.
Possibility of hitting a nerve.
Hitting a nerve. It will be a burning pain. It's very horrible. So look for those things. Now, there will be another question based on this. What are the tiny red or purple brown color spots that we see on the skin while performing the venipuncture or after the venipuncture? The options would be edema, emesis, petechiae, and all those things. So which one you have to pick?
Petechiae.
Good. Next. Seizures and convulsions. What will you do if the patient is... Yes, Azinath, what is your question?
I have a question for the last Petition.
Yes. Yeah.
Okay. Can can you draw blood from that area where the pink and the like the purple?
It's
Can
not
you draw?
it's not appearing exactly on the vein. It will be somewhere up or below or close
Okay.
to that area. It won't interfere with the vein. But
Okay.
observe that. If you have someone like with the petechia, so
Yeah.
whatever, like however you pronounce, like you have to watch, monitor, make them sit for 15 minutes because sometimes it will be like an allergic reaction, so it shouldn't spread.
Okay.
Maybe they need medical attention. Usually it goes away within 10 minutes.
Okay. Great.
Monitor
Thank
them.
you.
Okay,
Thank you.
these are the conditions that you'll come across. So seizures, I told you, what if the patient is coming, sitting there, you're poking the needle, now suddenly there is an involuntary action. This is something they cannot control. Don't tell them, put your hand down. No, they can't do. You will understand it's a seizure or convulsion. Immediately for safety, open the tourniquet, release. Alzineth, you have a question still? Okay, thank you. So immediately look for the safety. In that case, bring them down. Make them lie down and make sure there is no hard objects for them to hit. Sometimes it leads to head injury or they may injure, like it's very hard. Ask for help. Document it. Immediately you have to shout and ask for this is a condition, but sometimes you cannot even control. Make sure for their safety, bring them down and make them, they are not lying like this. In the supine or the prone position should be slightly towards the turn their body toward the lateral side. For these and all, you need some experience. If you are a new person for the phlebotomy, shout for help. Okay. So why then make the airway clear because they need the oxygen to the brain. It has to do something with the brain. So give them all these facilities so that they can breathe properly and they will not be in their own senses. Okay. Safety comes first. Safety for you first, safety for the patient is very important. Now review questions and case studies. Look at this. What is the best approach to use an 8-year-old child? Any questions? Eveline, go ahead.
Yes, ma'am. Regarding the seizures and convulsions, if, for example, we have already the assistance that we need, do we call the 911 for that?
Yes. In situations where they cannot control, it's prolonging, it's not a good thing. Yes.
Okay. Thank you.
Okay, what is the best approach? You have to follow the protocol. The protocols will be there. What if this happens? What you have to do? What if this happens? Which number you have to press? What if this happens? There will be sometimes buzzer. So these things you will know based on where you've been hired. So don't worry about all those things. Okay. So what is the best approach to use on an 8-year-old child who needs to have blood drawn? Explain the draw in simple terms and ask for the child's cooperation. Restrain the child using wet straps and collect the specimen. Offer the child a treat or toy if he or she doesn't cry. Tell the child it won't hurt and will only take a few seconds.
Explain the draw in simple terms and ask for the child's
The child's
cooperation.
cooperation. Let's see the answer. Yes, good job.
Yeah.
Which of the following is proper procedure when dealing with an elderly patient? Address your questions to an attendant if the patient has a hearing problem. Make certain to hold adequate pressure after the draw until bleeding stops. Speak extra loud in order to be certain that the patient can hear you. It says only elderly patient. It never says like a visually impaired or a hearing impairment, right? Tie the tourniquet extra tight to make the veins more prominent. Which one will you select?
Make certain to hold adequate pressure after the draw until bleeding stops.
Why do you think so? Why you came to that conclusion, Varna?
Ma'am, because of the fragile, their skin is fragile.
Collapsible veins?
Yes.
Mm-hmm. Let's see the answer. Yes. Okay. Clear, all of you? Any questions?
No.
Clear. Clear,
Now there
ma'am.
is a case study. Look at this. It's very interesting. Andre works with several other phlebotomists in a busy outpatient lab. This day has been particularly hectic, with many patients filling the waiting room. It means a busy day. Andre is working as fast as she can. Toward the end of the day, after Andre has finished drawing blood from what seemed like the millionth patient, it was that crazy busy. Sometimes we experience things like this. Even while handling the specimens for the 8-hour shift for testing in the core lab, it's overwhelming. We have to just walk, stand, load, unload, and then check for the tubes, pull it for the technologists. We will be like this majority of the time. Only on very rare circumstances during the Christmas time, I had few numbers. I was so happy, right? Why? Because we were just chilling on that day, walking, talking. Otherwise, we don't have time to even look at each other. That's the situation. Anyways, they mentioned to a coworker how extra busy it has been. The coworker says, yes, it has, but it looks like there's only one patient sitting there. Okay. Now, Andre grabs the requisition and labels and heads for the waiting room. There is one patient waiting, an elderly woman reading a book. Now, the paperwork is for the woman named Lucy Garcia. You must be Lucy, she says. Are we allowed to ask like this?
No.
No. Look what happened. Glancing at a name on the paperwork, the patient looks up and smiles. Now, the patient, maybe she's not hearing properly. Who knows? She smiles. Have you been waiting long? Andre asks. The patient replies, not really. And Andre escorts her to the drawing chair as a phlebotomist now. The patient is difficult draw. Andre makes 2 attempts to collect the specimen. The second one is successful. Now, another question. Legally, is it allowed to draw blood if the same technician has to do after 2 pokes on the same person?
No.
Legally, keep this in mind, as a phlebotomist, you should know the legal procedure is first time you're drawing, you're not getting the blood. The second time you're not getting the blood, stop, period. Go call
Yes.
another technician. By law, legally, you're not supposed to touch again. Third time poking, fourth time poking, no, a big no. Why? Because the patient can sue you. Legally, you're not permissible to do more than 2 pokes on the same patient simultaneously. Because first time you're doing no blood, second time doing no blood, stop. Okay, and he places the labels on the tubes, dates, initials them, bandages the patient, send her on her way. About 5 minutes later, a somewhat younger woman appears at the reception window and says, my name is Lucy Garcia. I just stepped outside to make a phone call and was wondering if you called my name while I was gone. The receptionist notices that the patient's name is checked off the registration log, which means under that name that has been taken. The receptionist turns around and asks if anyone had called a patient named Lucy Garcia. I already drew her. Now, Andre says as she walks over to the receptionist window, the woman at the window is not the one Andre just drew. However, her information matches the information on the requisition used to draw that patient. What are the errors that has been made? Do you think this is a post-analytical error?
It's a pre-analytical
Pre-analytical
error.
error. What is, according to the CLSI guideline, she has done a big blunder. According to the CLSI guidelines, 2017, what she should have done?
Identify the patient by letting the patient state the
That the
first
patient,
last
this
name
is why from
and spell it.
2017, they mandated, who mandated? Not me, the college, no.
ELSI.
CLSI mandated
CLSI.
errors like this have happened. Please, let's stop doing this. asked the patient to tell, what is your name? May I know your name, please? I know you have the requisition, there might be the names, but make sure, let them talk. I have seen certain situations where the senior John and the junior John, they come together and John, yes, me, and then the child will sit, but actually the phlebotomy should be performed on an adult. After drawing 2 tubes, he will say, oh, this is not me. My grandfather or father has to sit in the chair now. Oops.
Yeah.
That's why express consent.
Yes.
Implied consent. Things like this happens. That's why they say, okay, stop this errors. The best way to address is let them talk.
Like also there are 2 names, 2 exact names, but the
Date of
spelling
birth
of their
sometimes
names.
matches. Date of birth
Yes,
sometimes
ma'am.
matches.
Spelling is different.
So these things, yeah, spelling different. Check for the spelling. Verification again and again. Call the doctor's office. Is this a patient? They will check the file. Yes, this is the patient. I requested for the blood work. These things you have to confirm. You have to document. You have to initial. You have to write the time. You have to write the date. You have to document. I talked to the doctor at what time? 12:15. Did the doctor respond directly or some other assistant responded? Note down the name. No, the doctor responded directly. The assistant of the doctor by name XYZ responded. Why? If there is any error, if they happen to see, if they pull the file, your initial will be sitting there. They will call you. Can you please come to the lab? You have to go to the lab. Clear? Now tell me, what is the situation? What error did Andre make in identifying the patient? What assumptions did Andre make that contributed to drawing blood from the wrong patient? That's the only lady sitting. She thought she's the only one. She made this mistake. What is the identification error? She never asked the name that should come through her mouth, right?
She just assumed.
She assumed. And this one assumption now is going to give so many troubles to the other people who are there. Okay? Now, who might the other patient from whom Andre mistakenly drew blood have been? Another question. Now, how can the error be corrected? You tell me how these things can be corrected.
You'd need
by
to
asking the name properly to the patient.
Yeah.
Okay. Now, 2 phlebotomists went to a pediatric ward to collect a blood specimen from a young boy they had drawn many times before. The child told them to go away and that he was not supposed to have any more blood tests. The boy's parents were not present, but in the past they had always taken the blood because they have given the permission. But the boy is telling, no, I'm not supposed to give blood. But they are not listening. The phlebotomists, they ignored the child and one of them collected the specimen while the other restrained him. It was later determined that the boy's parents had earlier filed a written request that the child was to have no more blood drawn. Now, my question is, when the child says no, no.
You have to stop.
Yes. So it means legally
we have to
the
respect
parents
that.
can sue the technicians.
Yes.
That's true.
Right?
Yes.
Yes, this is the reason why the consents have been given verbal, implied, not the head, express consent, written consent. All these things are there because of these scenarios or these situations. What error did the phlebotomist make in drawing the blood? They never respected the child's words, okay, against his consent. What assumptions were made in deciding? Because he was there already, they were taking the blood, they thought, okay, this child is just telling, let us do the job. What might be the consequences of the phlebotomist's actions? They will be sued. There will be litigation. There will be some sort of litigation against them because they made a big mistake. Clear?
Clear.
Yes,
now,
clear, madam.
a common, look at this. How will you pick the answer? A common
Impaired. I mistake.
common mistake and one that is irritating to the dash impaired. Visually impaired is to raise your voice.
Raise.
Don't do that. They can hear you, okay? This is the answer. And a crying child. Okay, now what they are doing. Now here. This one. Dash a crying child as soon as possible because the dash of the crying and struggling can dash blood components and lead to dash test results. They already have given the answers. What's the point? Huh? Okay. Calm a crying child as soon as possible because the stress of the crying and struggling can alter the blood components and lead to erroneous results. Clear? List the 3 impairments that create challenges when working with the elderly. For each one, list the effect that these challenges can have on the communication process. Prepare this for tomorrow's test. Describe how you would handle each one, how to handle those situations. So far, so good. Any questions pertaining to this? This one we did yesterday, fill in the adaptive and challenging collections table. Once again, review this. Come prepared for tomorrow's test. Now, tell me the timing. Can that be 9:30 to 10:30 or 10 to 11?
It's okay for the 9:30 to 10:30 for me, ma'am.
Okay.
Yes, me too.
All of you?
Yes.
Yes, ma'am.
Yes. So before leaving, good luck for you.
Yes.
And what is the optimal age for collecting a neonatal screening card? Options. 24 hours, 24 to 48 hours, 72 to 96 hours, 7 days. So these you have to come prepared. Painting we know. And then how you have to transfer the device, the syringe, and the blood, you have to use the safety device. Okay. What will happen if there is a radiating pain? What could have been done? We all know, we discussed so far. Okay. What is the factor? Now, one more question from my side. What is the factor that may contribute to a patient who is fainting during the blood collection? I mentioned about this while just going through the slides.
Hypoglycemia.
Hypoglycemia.
Who is that?
Hypoglycemia.
Okay, good. Good job. So hypoglycemia is a contributing factor, low sugar. Okay. Now, a phlebotomist is approaching an inpatient. Okay. And she has to collect the blood, but the patient is unconscious. How can the patient be positively identified? Ask the nurse. And then if it is a shared room, ask the other patient. Confirm with the patient name on the door or compare the ID wristband against the labels.
ID wristband.
ID wristband. So all these type of questions when you get, be prepared. Okay. What is the consideration for collecting blood from diabetic patient? We talked about it. This is an important question too. Okay. So food collection not allowed. Food collection is allowed. Hand collection is allowed. Hand collection is not allowed because of thrombosis or sclerosis. These questions you have to bring it to your mind. Go through that slide in particular. Here the options: food collections not allowed due to risk of thrombosis, or food collection not allowed due to risk of sclerosis, hand collection not allowed due to risk of sclerosis, hand collection not allowed due to the risk of thrombosis. Which one will you pick?
Food collections are not allowed due to risk of thrombosis.
Thrombosis because of the extremities. Okay, we know we talked about the difference between venous blood and the capillary blood. Go through the slides. Go through the important points, mainly the red with the bold letters, everything. Come prepared tomorrow, 9:30 to 10:30. Even though it says 9:30, you all have to be at 9 o'clock. Good luck to you. I hope this is a good review. We covered a lot based on the slides, what they have been given. So good luck to you. Okay, come prepared. Have a wonderful evening. Thank you so much for being here. Okay.
Miss, I have a question.
Yes.
The last one there was that the foot collections are not allowed due to the risk of thrombosis.
Yes.
Okay, because I know the hand doesn't listed there. Okay, thanks.
So if you have any questions, even before the exam, if I have to give clarification, I will help you. It's not a problem. Okay?
So exam is at 11 o'clock or 11:30? What time is the exam?
What time they
9:30.
said?
9:30.
9:30? Okay, thanks.
Yeah. So come prepared. If you have anything to be clarified, we can talk about it. We have still time. So no worries. Okay?
Yes, ma'am. Thank you.
Clear? Okay.
Thank you.
Good luck.
Thank you.
Thank
Thanks,
you.
ma'am.
Bye, everyone.
Bye, everyone. Good luck for
Bye.
tomorrow.
Bye.
Yes.